Good morning. Good morning, everybody. If we can, we're going to start now. So if everyone can just sort of settle in, and conversations there'll be plenty of time for talking. Well, I will ask that if anyone needs to have a conversation, it's a great space outside where the coffee is. It's a good place to have the conversation rather than in here. As I said before, the journey we're going to be on today, this is really a journey. It's not always going to be one that we'll be comfortable with, but it's something we really have to pay deep attention to because it is something that is really shaking the very foundations of our society. I'd like to first introduce, for greetings, Karen Kasner. Karen is the co-chair of the Jewish Community Relations Council of New York, and I'm Rabbi Bob Kaplan. I am the executive director for the Center for a Shared Society at JCRC. We are the Intergroup, Interfaith, and Community Building division of that agency. And Karen is the co-chair of the commission, along with Josh Moskowitz, and the former and founding chair of government relations here at UJA-Federation. So without further ado, Karen Kasner.
Thank you very much, Bob. Sandy Hook, Nashville, Marjorie Stoneman Douglas, Tree of Life, Club Q, Uvalde, Nashville, from the Bronx to Staten Island, from Brooklyn to Manhattan and Queens. Headlines across the United States, including New York, struggle with a surge in crime and gun violence. The pandemic exacerbated this issue, and the need for public safety became the number one topic on everyone's mind here in New York. Last July, when we faced an increase in gun violence here in New York, a few of us began a conversation and convened a small group from the community to listen to each other's questions, their concerns, and their community's top priorities in the ever-changing, complex, and changing landscape. We then held our first forum in December, which featured a panel of experts on the issue of gun safety and gun violence, including A.T. Mitchell, Mayor Adams' Gun Violence Task Force Chair, Andrew Edelman of Everytown for Gun Safety, and Natasha Christopher of Mothers for Safe Cities, the 67th Precinct Clergy Council, as well as Rabbi Menachem Creditor of UJA-Federation, author of many writings, including Rabbis Against Gun Violence. How can we as a community collectively respond? How should we as a community respond? What can we do as responsible citizens and community leaders to discuss, convene, educate ourselves and others, and take action? Today, you will hear from a myriad of New York community leaders and leading experts to address the concerns, to answer questions, and to discuss what we can do, whether in the community, whether with our service providers, whether with our government, or with each other. I would like to particularly thank Bob Kaplan, Director of Shared Society Center of the JCRC of New York, Emily Botkin and Rachel Lissy of JCRC, Rabbi Menachem Creditor of UJA, Louisa Chafee, who is here, formerly of UJA, and now Director of the New York City Independent Budget Office, and Margot Paz of UJA for making today possible, along with countless other organizations who serve as co-sponsors, as well as our amazing group of panelists and keynote speakers. I'd also like to welcome the President of JCRC, Ben Golub, who is here in the audience, as well as our CEO of JCRC, Gideon Taylor. We also have the Bronx DA, Darcel Clark, who will be speaking to us at lunch, and we are thrilled that each and every one of you are here to participate. Hopefully today you will walk away with a deeper understanding of the issues facing us and what can we collectively do to change this dialogue and narrative. There is on your table, and you'll hear throughout the day, one of these where you can download so you can get not only the information of today of the bios and the agenda, but also action steps and resources going forward, which will be changing all the time. Thank you. It is now my pleasure to introduce Reverend Charles Galbraith, who does not need an introduction. He is the pastor of the Clarendon Road Church, but I wanted to point out his deep commitment not only to his church, but to the betterment of the community by serving on many advisory boards and councils, from the mayor's office to the community board, to SUNY downstate, to the 67th Precinct Clergy Council, and more. Without further ado, Pastor Charles.
Good morning. Oh, sounds like it. It's an honor and privilege to be able to share with you today. Thank you for that wonderful and generous introduction. Thank you to Rabbi Kaplan for the opportunity and invitation to the JCRC as well as the UJA for this opportunity and invitation, and for all of us who are gathered here together. As we reflect on this time concerning addressing and ending gun violence, I want to begin with a story of my own experience that started about 13 years ago at the founding of the 67th Clergy Council, also known as the God Squad. It was one of those warm summer nights where I received a call. You know those calls, not at 7 o'clock or 8 o'clock, but one of those midnight calls, that there had been a shooting and violence that had once again afflicted our community of central Brooklyn. Jumped out of my bed and started to get myself together and get dressed to prepare to go to the street. As I was preparing and getting myself together, my wife looked at me and with puzzlement within her eyes asked, "Where are you going?" I said, "Unfortunately, there's been a shooting within our neighborhood, and I've got to go. I need to be at the scene." She responded with, I think, concern, but also with a little bit of cynicism as well. She looked at me and said, "You're a preacher. What are you going to do?" I looked back at her in that moment, still with a little bit of dizziness, being awoken from the sleep, and responded, "We're going to end gun violence." As we think and reflect on this scourge that has afflicted and affected our neighborhood and communities, I believe that we must vision with an idea and ideal to not just reduce gun violence, but to eliminate it. Just for the few moments I have, they just gave me a couple moments, that's a problem for a black preacher. But for the few moments I have, I want to share and reflect on the idea of a prophetic picture of the possible, visioning abolishing gun violence. I must pull from the sacred text of my tradition and some of your traditions to think about what does it look like to imagine what seems to be impossible. I think there's something significant about imagining and visioning, particularly from a faith perspective, where we're able to engage, as Walter Brueggemann talks about, this prophetic imagination that criticizes what is currently broken, but then re-energizes and imagines what has the possibility to be. Imagination is visioning. It's illustrated in Dorothy Day's Hospitality, Dietrich Bonhoeffer's Resistance, Dr. Martin Luther King Jr.'s Dream, and Gustavo Gutierrez's Understanding of the Option for the Poor. Imagination is not fantasy, but rather deeply connected to the contextual reality and the environment in which it is located. Fantasy is just thinking, saying words makes dreams come true. But imagination is saying these words, but also engaging in reflective praxis and action to actualize these words within a reality. Let me give you some words, sacred text. Zechariah, the 8th chapter, there is a picture of a vision of what can be that I believe is possible today. The text says, "I will return to Zion and dwell in Jerusalem when Jerusalem will be called a faithful city, the mountain of the Lord God, the holy mountain. This is what the Almighty says. Once again, women and men of ripe old age will sit in the streets in Jerusalem, each of them with a cane in a hand because of their age. The city streets will be filled with girls and boys playing there. I love that image. I love that picture of what is possible. But as I shared with you, imagination is not just wishing something to be, but rather engaging in reflective, thoughtful praxis and action to actualize it. And for that, I have to take the challenge on myself. For that means for me, and I also believe for many of us, examining purely performative practices. I'm not here to give you a sermon, just here to give a little talk. But as I look at this passage, I'm reflective of right before it. It shares about the people who were engaging in fasting, but were not really truly being connected towards the issues of justice. The command and correction that is lifted up for them is to say, administer true justice, show mercy and compassion to one another. So I'm thankful for our gatherings of a religious experience. I'm a preacher, I'm a pastor, it's what I do. But if that is not spilling into the spaces and areas where there is violence and pain, then it simply is performative. It must be challenged. Not only are we called to examine the practices that are purely performative, but we're also called to occupy these spaces with a prophetic imagination. I love this passage because it paints a picture of a city. A city where people are gathered, a holy habitation where there are no bad neighborhoods but simply holy ground. A place where there is longevity of life, where there are individuals who are growing in their fullness of their life. I love that image that shares of those mothers and fathers who are holding canes in their hands because they've had the opportunity to grow old. There's a gun violence march that happens every year in my neighborhood. And the first year that I marched in it, I was struck by the call of many of the young people and the chant that they lifted up. One of the chants they lifted up was this chant, "Don't shoot, I want to grow up." Don't shoot, I want to grow up. The possibility and the luxury within our cities, within our world to grow old, to see the possibility. And then I love that last part that says, city streets filled with girls and boys playing there. An image of streets not flooded with guns and shell casings, not flooded with chalk marks or police barriers, but rather streets flooded with laughter and joy and celebration, where the smell of smoke is smoke from the grill, not smoke from the barrel of a gun, where the shouts of joy are shouts of celebration and not terror, where the blaring sounds are the sounds of the electric slide and the cha-cha slide, not the sounds of blaring police sirens, stress. It's an image that we can see. That yes, we are called to our religious experiences that are deeply formative to us, but it must go beyond us to touching those connected in our world, in our society. That we occupy these spaces with a prophetic imagination, that we're daring to say of what can be. I remember we were meeting with some consultants who were helping us craft our message as the God Squad, the 67th Clergy Council, and they talked about the opportunity for funding and how you needed to have certain goals. And many of you know about consultants and how you have to form things in a particular way for the funding sources and the sponsors to get behind you. And they said, let's talk about this idea of gun violence. We want to reduce gun violence by this much. We want to bring it down by this much. They said, no. We're making a stand. We want to eliminate gun violence. They said, well, that doesn't play that well. Is that possible? We said, we believe it's possible. We have to believe it's possible. That our young men and young women can grow into old men, old women. That we can grow in our faith together. The last thing, we'll always be careful when a preacher says the last thing, because it's about 3 different last things. But the last thing I have to share is this, that our imagination must also have demonstration. That it's just fantasy if it just stays within our minds, or it's words that are just lifted up during panels and speeches and reflections. But imagination with demonstration causes us to get our hands in it. Once again, looking to this text in Zechariah, that 8th chapter, it declares, do not be afraid, let your hands be strong. The idea that we're called to engage in the full practice of unmaking and unlearning of violence. That we are called to do the work that people are wondering, why are you doing this work? Is because we are saying we are deeply connected, we are deeply invested, and we believe in a prophetic imagination of a place and space where there is no more violence. We offer this prophetic vision where, in the words of the prophet Isaiah, the swords shall be beat into plowshares. We offer the shared vision and the idea that we would study war no more. We offer this shared vision in the words of the psalmist that we would bring an end to the violence of the wicked, make the righteous secure. I'm confident that not just our words, but our collective, engaged, reflective practice can be embodied where we can build a city of faith where, in the words of Ray Bakke, there are no bad neighborhoods, but simply holy ground. Let's undo violence. Thank you.
Pastor Charles, all I can say is that I think that our souls, our minds, our hearts, our beings are lifted up, and you have put a challenge in front of us of not just saying a little bit, but we need to truly eliminate. So thank you so much for your setting the pathway of faith before us as we take our next steps in this journey that we are here to do today. And again, it's a journey. This is not a forum, folks. This is not a conference. This is a journey. This is us who have chosen to spend our time here together this morning that will allow us to take some next steps together that will be part of that grander puzzle of leadership, faith, and otherwise that will get to that holy ground, that will allow us to see what's in front of us. When we started this, we were a little, nervous. Who do we bring to the table? There are so many people out there who have such deep levels of expertise, but we wanted to make sure that this time together today will be that important to you, that informative to you, that it would allow you to take some of those next steps and walk away from here not only educated and informed, but inspired. Inspired to become part of the solution rather than be okay with the problem as it sits. And again, I want to thank the DA. She will not be joining us for lunch. However, she's unfortunately has to leave early. She's been called away by the governor. But I want to thank the DA for every day. We've developed a very close relationship every day, waking up and knowing what her responsibility is to the people of the Bronx in our city. About 30 years ago, when my beard wasn't so gray and he was a very young person, Michael Dowling, then working for Governor Mario Cuomo, was asked to keynote a conference that was going to also build a movement around inclusion of healthcare with immigrant populations throughout the city. It was the first coalition that I had the honor of helping to incubate. It was called the Northern Queens Health Coalition. Michael will remember it well. And it was around the issue of immigrants and the healthcare system. It was held at the YWCA, it was known as the Korean Y in Queens. It was an era when, as unfortunately an era that we're sort of in right now, when immigrants were not always seen in the best of lights. Michael Dowling came and inspired us, spoke to us, and allowed us to take the next steps of getting to where we needed to be. Since then, he has built a magnificent collage of healthcare facilities throughout the New York area, and now I understand a little bit in Connecticut and up in New England too. And Northwell Health takes care of people, and I think that's really where his heart comes from, taking care of people. Because under his leadership, what has happened is that Northwell has taken a step to make sure that gun violence is now on the lips and the list of important issues that Northwell is looking at from a public health perspective. Not to steal any of his thunder, I'd like to introduce Michael Dowling, the CEO of Northwell Health.
Good morning, and thank you very much for inviting me to speak for a few minutes. I do remember that meeting well in Queens. It was not an easy thing to deal with back then, but it's important in that context to remind ourselves that we're all immigrants. We all come from someplace. I'm a first-generation immigrant, but we all are the sons and daughters or relatives of immigrants, which is an important point to keep in mind all the time when the issue of immigration comes up, which we're still very, very actively involved in. I also want to say that I'm delighted to meet a lot of old friends here, and the person that I met this morning, Michael Miller, whom my first trip to Israel was with Michael Miller 35 years ago, when we spent, as part of a delegation, about 10 people, we spent over 2 weeks in Israel. Met with the Prime Minister Rabin at that time, toured all parts of Israel. I've been back a couple of times since. But Michael, great to see you. Thank you for opening my world to a whole new world back then. So wonderful to see you again. And the other thing I want to mention is to say thank you for engaging in a discussion on this issue, because it is an issue with multiple ramifications throughout society in general. And there's a lot of work to be done, and as was mentioned in the introduction, this is a long-term effort. This is something that we have to stay committed to for a long period of time, because to get to where we want to get to, it's going to take time, and it's going to take persistence, and it's going to take grit, and it's going to take courage. So what I'm going to do is basically talk a little bit about the issue at the beginning, repeat obviously some things that you already know well, but then talk a little bit about what we're doing at Northwell, both regionally and nationally on this issue. I can say that we have been one of the few organizations, healthcare organizations, nationally that has taken a major leadership role on this issue. So I'll tell you about what we're trying to do. And I do think that there is a wonderful responsibility by all the not-for-profits, could be led by this organization, to bring all the not-for-profits together around the region to develop a coalition of influence from all disparate organizations to begin to work on this as a major public health issue. So we all know, for example, And this is the reason we're in this country, that the U.S. is known for having wonderful distinctive characteristics. The reason we all came: democracy, opportunity, freedom. And we can recount all of the pluses about the United States and what a wonderful country it is. But we've also become distinctive for things that we should never be distinctive for. And one of them is gun violence. 40,000 people die from guns every year. 71,000 get injured by guns every year. And that number is increasing, accelerated post-COVID. There are about 400 million guns owned by Americans today. An extraordinary number. Of all the kids between the ages of 0 and 14 that die from guns in the developed world, almost 90% of them are in the United States. That is not something that you should be known for. Guns are the leading cause of death for kids and teenagers, adolescents. Second leading cause of death are automobile accidents. And the third leading cause of death is cancer. But the number one, guns. And we spend a lot of time reading about mass shootings. Just picked it up today's New York Times. There are 2 mass shootings in the last 3 days. But you know, it happens so frequently now, we don't pay an awful lot of attention. It's just another story. We quickly read it, turn the page, and move on. Because we've been hardened to it. But it's important to remember that mass shootings are less than 2% of gun deaths. While it gets some attention, it's only less than 2%. It's the one-offs that occur that causes the bulk of the problems, which we're very familiar with every weekend in New York, every weekend in any major city, every weekend in rural areas. It's not just the cities, which some people would like you to believe. So this, to me, is a major, major public health issue, and we have been promoting it as a public health issue because when you work in the business that I work in every day, we see the kids coming in shot. We've had a 400% increase in our children's hospital in the number of kids coming in with gunshot injuries in the last 12 months. There is a Netflix show now that is showing. It's about Northwell. Netflix did it. It's the third one they've done. It's called Emergency NYC. If you haven't seen this, I would strongly urge you to see it. It's not a commercial on Northwell, but it tells you about what goes on in the healthcare world. But a big part of that story is about one black teenager shot. And his concern, and the family's concern, when the Netflix show came out, was that if the gang saw him or recognized him as being in the show, and the fact that he got shot was a show of weakness, that they might come and kill him. And we had to deal with that. But it's not only the individual injuries that we see all the time, including one of my own staff members who was shot and killed across the street from my office in Long Island. And she went to her car to put something in her car at 4 o'clock in the afternoon. And her boyfriend was waiting and put 5 bullets in her head. We see it. A family, husband and wife, comes to our pediatric hospital not too long ago to see their sick kid. They're on the floor in the ward in the pediatric facility where there are all these kids. See their kid who was sick. They got into an argument. He pulls a gun, puts it to his wife's head. On the floor of the hospital, threatened to kill her and all her staff. Fortunately, our security are adept at this, prevented a bad situation from occurring, got to his car. He had 14 guns in his car. So you have the individual issue, which is affected by this. You have the family issues of the victim, but also the family members of the shooter. Distraught. You have the community issues. For those of you who walk around the communities out there, as the preacher just said a few moments ago, and I've been out there quite a lot, the palpable fear in those communities about what might happen. Pretty extraordinary. So it's a public health issue. So its impact is huge. We are all affected by it. This is why it's great to have a meeting like this, and there needs to be so many more. Because we have a collective responsibility to do something about it, especially those of us in some leadership positions in our various respective organizations. So my involvement and our involvement began, and I should say, by the way, before I mention this, is that my wife was in the middle of a major shooting at Beit Israel Hospital many years ago. She survived, but her boss and her boss's boss were shot. The person who did it, whom I knew, did some time. He had shown up in the hospital in one of the facilities on 14th Street with a trench coat, earplugs, Israeli Uzi, 2 handguns. Asked to see my wife. She goes to the front. He shoots the fixtures and the ceiling from above her head. Why he didn't shoot her, we don't know. But he did time, was released, and was having breakfast on the top of the World Trade Center on 9/11. So about 4.5 years ago, I was sitting at home on a Sunday evening watching and listening to some of the news again about some of the terrible things happening and the politics of it all, and saying that we in healthcare had to do something. We at Northwell, we are the largest provider of healthcare in New York. We are the largest employer in New York State, largest private employer right now with about 85,000 employees. And therefore, you have to ask yourself, when you stand in these roles, what is your responsibility? It's just not inside your own organization. I believe strongly that we have a responsibility externally to make a difference in the broader world, not just only make a difference inside our organizations, especially when you're in the healthcare business, because this is a public health issue. You affect all of the communities. And so what I did after that, when I was at home on Sunday, the following day, I took an ad in the New York Times. Took a full-page ad in the New York Times, basically saying that all healthcare leaders and the leaders of all healthcare organizations should take it upon themselves to lead a campaign collectively to deal with gun violence as a public health issue, highlighting the issue that it is the largest killer of kids. You know, if you stood up here and said, you know, cancer is the #1 leading cause of death among kids, you'd generate activity immediately. And we do a lot with cancer in kids. It's not cancer, it's guns. So I took an ad out. And I called around the country to many of my friends because, you know, I've been in the business a while. Pretty much know every CEO of every large healthcare organization in the United States. And I called to many of my friends from Texas to California to Mississippi, Alabama, and I could not get anybody to participate. From my good friends, they said, I agree with you. This is important. It's a horrific circumstance, but it is the third rail. It's too dangerous. Members of my board are members of the NRA. The politics of my local community, pretty drastic in this regard. So I don't want to get out there. It was frustrating, but you know, you don't give up. Persistence makes a difference. Continuing commitment makes a difference. I ended up, as a result of this, plus other things, having to have security at my house round the clock for about 4 months. That, plus the issue of the vaccine mandate, I ended up having hundreds of people in front of my home, walking up and down in front of my home with megaphones, carrying swastikas. Pictures of me, my hipless face. When I'm not at home to this day, if I stayed in the city tonight, I have to have a cop in my driveway to protect my wife. But you persist. You all know this, more than most. So we put that ad in the Times, and then we created a Center for Gun Violence Prevention and Safety inside the organization. So we have a major center inside Northwell, led by Dr. Chetan Sathya, pediatric trauma surgeon, whose first case was taking a bullet out of a 6-month-old baby, who survived but is paralyzed, who recently did a surgery on a 12-year-old girl walking to school not far from our hospital with her backpack, just going to school. Drive-by shooting, gets to our hospital, saved her life, but paralyzed from the neck down. So the other thing we did, we decided to hold a national forum on gun violence every year. We held one earlier this year. This year we had about 700 people show up. We had about 2,000 people on Zoom. We bring together some of the top national leaders dealing with this issue. I work very closely with the Bloomberg Group. I work very closely with Gabby Gifford, with all of the organizations. We know them all across the region and nationally. We deal with the White House. We deal with members of Congress. Senator Chris Murphy from Connecticut is one of the leading players nationally, a fabulous, fabulous guy. If you're having a meeting at some point that is further beyond this, subsequent to this, it would be a great thing to have Chris Murphy participate. He has written a fabulous book about violence in American history. Probably the best book written about violence in American history ever written. So we did the annual forums. We do them every year. And then we decided to engage in a major awareness campaign. So we work with the local police. We work with local gun owners. We work with the schools. We work with the teachers. We do extensive education across our region. And it's interesting that when you're out there and you talk about gun violence and you focus in on the children's issue, that you get a lot more traction. We do not deal, at least I don't, deal with the Second Amendment issue, the right to bear arms. That you don't get a lot of traction on. Some may argue that that's what you should go after, but to me, I go after it as a public health issue, focuses on kids, the effect on families, showing the cases. So we ran a major awareness campaign. We put some TV ads you may have seen our TV ads. They're run pretty consistently. Actually, we can play the ad if you have it there. Let me play the ad. And we may want to play it twice so you get the message, and then I'll explain what we're trying to get across. But this is being used on the TV on a regular basis.
Hi, we're Nathan's parents. We just wanted to ask, and it's totally cool. There's no issue. The tiger.
And we were just wondering if he'll be locked up.
Yeah, will the tiger be locked up for the whole time?
Absolutely. We never let him out with kids around, not even our own.
It doesn't kill to ask about unlocked guns in the house. Guns are now the leading cause of death for kids.
So that's probably the idea here, which is getting unbelievable. We've studied this, unbelievable positive receptivity. Has changed attitudes. You know, if you send your kid to a neighbor's house and your kid has an allergy to a cat, what do you ask? The cat in the house. Where is the cat? Why not ask the same question about guns? You remember not too long ago the case in Virginia, the 6-year-old kid who goes home, gets the gun, goes to his school, and shoots his teacher. You ask the question, where did he get the gun? The gun was definitely not locked up. Unlocked guns are a major cause of gun violence. So this ad we make available across the country. So the other thing now, following up on what my call to all of these CEOs years ago when I got no response, we continue to push to get these people understanding. And I've spoken nationally on this a couple of weeks ago. I was asked to speak because things are improving. Awareness is happening. People are changing their minds. You're not seeing the results out there yet, and you won't for a long time. But that doesn't mean something positive is happening. I was asked to speak to the Council of Teaching Hospitals in Chicago a month ago. These are all the deans of all the medical schools. Typically, their program is all about medical education, et cetera, et cetera, et cetera. They asked me to come to Chicago and speak about gun violence. And a unique, distinctive invitation by that organization that never did it before. So let me go back to the CEOs. Today, I have created a National CEO Council on Gun Violence Prevention and Safety. Today, I have 55 CEOs of the top healthcare organizations in the United States have signed on the dotted line their commitment to engage in a national awareness campaign about gun violence. 5 years ago, I couldn't get one. I got 55. Now, they're from Texas. They're from Mississippi. They're from California. They're from the red states and the blue states. Had a Zoom meeting with them all this week, last week. We are working out on a couple of items. We are hoping, and this will continue over the next month or two, but we have had discussions with the Ad Council. You're aware of the Ad Council, which runs massive national campaigns on unbelievably sensitive issues. Very, very good to work with. I had them present to the 55 CEOs at a Zoom meeting last week, and we've tried to see if we can engage the partnership between the CEOs of all of the big health systems. Imagine the influence of that collective group, right, on a public health issue like this. We do a campaign with the Ad Council and do a national awareness campaign on prevention and safety. And I think that you're going to see that happening. So that's one major issue. The other major issue we're dealing with is to collect a data, create a database. There is no process at the moment to collect from every single healthcare facility the data on the violence that shows up, the results of the violence that shows up in the various facilities. Imagine what that, if I can just give you the data on my health system, which is humongous, imagine if you developed a collective database from every healthcare organization in the country and you make people aware of it. So we're working on that issue. We're also working on, and we do this at Northwell, when you come into the emergency department, we do what we call universal screening. So we ask questions of people who come to the ED a lot. We ask about tobacco. We ask about health issues. We now ask about their relationship with guns, their experience with gun violence. People talk to you about this, and then we make referrals to other organizations for these people. We have screened about 20,000 people. We have an NIH grant to do this as a research entity, so I'm urging strongly, and we're getting a lot of receptivity, to have this done at every hospital and every healthcare facility across the United States. And then we're working together, the group, on workplace safety. I wrote a piece about this recently that was published in Becker's magazine. I never thought that I would be spending tens of millions of dollars to protect my patients and my employees from people with knives and guns. So we have now in most of our hospitals, when you walk in, we have this technology that you have to walk through. It detects whether you're carrying something. It's an expensive proposition. The technology is pretty great, but behind the technology, you have to have the security. So it's very expensive. We've enhanced our security across all of our organizations, but nothing is foolproof. Yesterday, I get a call in the morning that we had a patient who was being treated in the room by an employee, and he pulls a knife. Big. And we finally, after hours, were able to get him calmed down, take the knife. How did he get the knife into the hospital? He came in through the ambulance. Now we have to figure out, how do we screen ambulances? We never had to deal with this. Never even thought we would have to deal with this. It's an unbelievably expensive proposition. That's the world we're in, unfortunately. Therefore, it's incumbent upon us to figure out, as the preacher said earlier, how to dilute it, how to change it. And you've got to take a public health approach to this, in my view. You're never going to get rid of guns, not in the politics today or in the foreseeable future. But we've got to take action, advocacy-wise and otherwise, to reduce the impact. Just imagine what we've done, for example, with automobile accidents. At one time, automobile accidents were one of the leading causes of death. So what do? Seat belts, airbags, front of the car where the passenger is the soft leather, changing speed limits. It is no longer one of the leading causes of death. You can take other examples like smoking, drinking. So you've got to be tactical about this. Because we're in an environment that is, I find it interesting when I look at some states that are willing to take away the books from a library, but allow people to keep their guns. We'll take your book, but here's a gun. Okay? And two other points I want to make. There's one other very complicated issue that we got to put our heads together to figure out how to deal with. I don't have a clear answer here, and we have to be very, very, very careful how we articulate this. And that's the relationship between mental illness and guns. We have a horrific mental health problem. If you were to ask me now, what is our biggest issue that we in Northwell are dealing with, it's the phenomenal growth of mental health. Extraordinary. 800,000 people in the New York area suffer from mental illness. We at Northwell, we are the second largest providers of mental health in New York State. And we take care of about 25,000 people a year. The population born after 1995 have the highest incidence of suicide, anxiety, and depression of any group of people ever studied. And a direct relationship between that and social media. So we have a social media problem. Let me get back to mental health. For those on the other side of this argument, they will make the claim this is a mental health issue. Now, there is a component of the people who commit crimes that have a mental health issue. But not all gun violence is mental health. So you have a gun issue, a mental health issue, and there is a crossover. So we have to be careful. We have to deal with the mental health issues. But we can't fall into the trap of assuming that all gun violence is the result of mental health issues. That is too simple. That falls right into the argument on the other side. It's not the gun. It's the crazy person with the gun. That's too simple. We have to figure out how to articulate this. We can't avoid it. As healthcare people, some people on the left would like to disregard it altogether and say we can't talk about mental health. It's all about the gun. No, that's too simple also. We have to acknowledge that we have a mental health issue, and a portion of the gun issues and the gun violence is associated with mental health, but not all of it is. Only a small portion of it is. So we have to be careful how to articulate this. And lastly, I'm one that always believes in optimism. You have to believe, as the preacher said earlier, that you can get to a better place. You go through cycles. Now, I always remember way back when Ralph Nader came out with his proposals on how to make automobiles safe, because they were a big killer. And he talked about airbags, and he talked about seat belts, and I remember everybody arguing, that will never work. Nobody will make cars with seat belts and airbags. Car manufacturers won't do it because it's too expensive, and if you put them in, nobody will use them. Now that's what, 30 years ago, 35 years ago? Try to buy a car today without a seat belt and an airbag. So there's hope. Because one of the things that we, you, I, and others in this field, we have to have a continuing sense of optimism that it can get better, it will get better, but only because we are persistent in our advocacy and in creating awareness and in arguing that we're better than this. The United States is better than this. When you go to other countries, and I travel, and I know you travel, you go elsewhere, people talk to you and say, what's the matter with the U.S.? Why? Our politics is toxic. Hopefully, that will change at some point. But we have to maintain our consistency of effort. Now having most healthcare organizations involved and committed, I think is a step. Especially when I get CEOs from places that prior were afraid to put their names on something. And I actually took an ad in the Times about 4 weeks ago, and I had each of those CEOs sign, and I took a full-page ad in the Times with their signatures. Not just their names, their signatures for everybody to see. So from having nobody to having 55, and that number is growing, I see some progress. So I would say continue the discussion, continue to find ways to articulate the issue better. But I do believe by talking about gun violence as a public health issue gets you more traction. That's the tack that we're taking. We have become a national leader on this. I got next Tuesday night, I'm meeting again with Gabby Gifford. She has been here with us. She's been a strong advocate along with a lot of others. And we've had meetings where we've had people from the White House show up, people from the Senate and the Congress show up. There's a lot of people out there who want to do the right thing. It may not appear like that each and every day when you pick up the newspaper, but there are a lot of good people out there. But we have an obligation. To me, when you're the leader of any organization, you have a special obligation and responsibility. And it's just not about to make your own organization do well. It's about to have the community do well. And so with that, I thank you for the invitation. Thank you for having me here. Stay focused and let's get work done. Thank you.
Congressman Greg Meeks taught me something called, and again, traveling with him, he said, you got to be consistent and persistent. Michael Dowling just sort of living example, as he used the word consistency, consistent and persistent notion of how you change the world, how you go from 0 to 55, so to speak. By the way, the speed limit is not 65 in many places, so it's just magnificent, just wonderful. And however, there's so much more road to go. However, putting your organization and the power of your organization and the power of your leadership is just inspirational and really tells us all, and that's really the name of the game, is we take our responsibility as leaders to take those next steps. That's really what this journey that we're on is about, taking those next steps, making sure that we get to where we need to be. One of the organizations that, and by the way, I just want to point that again, on your tables you have these QR codes, has all of the agenda for the day, action steps, legislative stuff, connection to the organizers. There's also a Twitter handle for today, so if you're hearing anything that really stands out in your mind that you want to let somebody else know. Twitter is not only used for increasing the polarity in our society, the toxicity of that polarity can be used for change as well. And that's sort of how we have to change the paradigm of what we're doing here. You can go on and sort of spread the message beyond just this room. One of the organizations that's out there making sure that it is literally on the front lines of that change is Vera Institute. And while you can turn again to that online space to get the biographies and go deeper into who we're going to be hearing from now, Vera Institute has just taken such a lead in making sure that, as Michael Dowling just put it, we are living in a safer society for all of us. Safer society for all of us. Hear the stories and it just makes our hearts weep, but we need a safer society for all of us. So I'd like to now introduce, to give us some more information, to take us on another step of this journey today, Daniela Gilbert.
Good morning, everyone. It's an honor to be here. My name is Daniela Gilbert, and I lead the Redefining Public Safety Initiative at the Vera Institute of Justice. As the rabbi mentioned, the Vera Institute of Justice is a leading criminal justice organization that focuses on ending mass incarceration, protecting immigrants' rights, ensuring dignity for people behind bars, and working to build safe and thriving communities. I'm honored to be here, and it's wonderful to see some familiar faces. I worked with Pastor Monrose when I worked at NYPD. Great to see you, Pastor Monrose. And you'll all be hearing from Akila Sherrills later this afternoon, which is a real treat, and you'll find out more later. I'm going to try not to steal much of his thunder. So I just want to share a little bit about my background and what brings me to this work. So I'm the granddaughter of refugees and survivors of state violence. All of my grandparents either survived the Holocaust or fled Europe to find safety in Israel and Mexico. And because of that experience, I've always been passionate about safety as a fundamental right, as well as looking specifically at the role of the state, the role of government, in either promoting safety or inhibiting safety and leveraging that power for good rather than for harm. And so as I share some remarks today, you'll hear the theme of, what government can do, and of course, government in the context of democracy is designed to be responsive to people. And so I really appreciate what our keynote shared around the role of a coalition of influence and the responsibility that all of us have. So I hope as I speak, you can think about how the information that I'm sharing might relate to your roles. So a couple of themes that you'll hear are the role of data and information in guiding policy and decision-making, as well as the power of people, the people in this room, but also the people who are on the front lines of trying to address gun violence, who have survived years and decades of trauma, who have experienced criminal legal system involvement, and who are best positioned to address this issue at the front lines and require support from everyone. So just want to share a couple of data points that complement what was shared this morning. So the increase in risk of gun violence for young people is, of course, tragic and hugely problematic. And it's also important to recognize that the average and median ages of victims of homicide in our country are in their late 20s and early 30s. So it's really important to pay attention to these issues as they affect youth and pull at our hearts in justifiable ways. And it's also really important not to ignore and neglect the fact that these are issues that affect adults in our communities as well, and really require attention around the kinds of interventions and supports that will lead people to make safer decisions. So when we think about gun violence, it's important to recognize that the incidents that get the most attention are important, of course, but don't tell the whole story, don't tell the whole picture. So, as I was preparing for my remarks today and refreshing myself with the data, it was really striking to me to find out actually the majority of gun deaths in the U.S. are suicides. I think that's something not a lot of people are aware of, and I think it really speaks to the challenges around mental health and trauma that were previously mentioned, and speaks to the importance of investing in prevention. And as we think about gun violence and ways to end gun violence, it's really important to make distinctions between prevention and intervention. So preventative measures are measures that focus on delivering outcomes in 5 to 15 years. Intervention focuses on immediate results. And so if we want to transform our society and end gun violence, we really need to be able to do both, right? We need to be able to walk and chew gum, as they say. So another data point that I really want to elevate is when we look at homicides, the risk of homicide is not distributed evenly. And like was mentioned earlier, mass shootings, tragic and alarming, are a small percentage of the homicides in our country. Black Americans represent the majority of gun homicide victims. Black Americans are 12 times more likely than white Americans to die by gun homicide. That is a chilling injustice and should never be forgotten when we think about what we're doing and who we're trying to support to address this issue. Community violence is an issue that is concentrated in neighborhoods, and it is experienced in a concentrated way and is not the only form of violence that cities experience, but it's important to address because of the way that it affects networks. And so what we know is there's a small number of people in communities that are at greatest risk of involvement in gun violence, at greatest risk of being shot or of shooting, and that people who are likely to be victims or likely to be suspects typically look very similar on paper. So the notion that there's bad people, there's good people, obscures the fact that there are people who are in risky situations, who have experienced a great deal of trauma, and who need support in making different decisions. So when we think about the kinds of interventions that should be built in cities, they ought to focus specifically on helping people change their behavior and make healthier and safer decisions. So I'd like to share a summary, sort of an overview of the kinds of interventions that have been effective in reducing gun violence across the country over the last few decades. And I neglected to mention that I've been doing this work for about 14 years. I began working with cities on reducing gun violence in California in 2008, and it's really heartening and hopeful, speaking of hope, to see the level of attention and discourse around the issue that there is now relative to what there was even 14 years ago. And of course, when I began working on it, there had been people working on it for decades. And so I think, the idea of hope is critical, and of remembering that there are the seeds of solutions and the seeds of change happening, and it's a matter of continuing to bolster and elevate those. So when I began this work, there were debates about what's the solution. Do we do street outreach? Do we focus on individual intervention? Do we rely on police? Do we rely on clergy? And the answer really is all of the above, right? We know that intuitively, any complex problem doesn't only benefit from one solution. It benefits from an array of solutions. And so the idea of an ecosystem has emerged as a really helpful illustration of the kinds of interventions and networks that cities and communities across the country really need to try to address this issue. And so what those ecosystems look like include a variety of measures, relying both on prevention and intervention, relying on hospital-based intervention, relying on systems that look routinely at the incidence of gun violence on a weekly basis, in some cases on a daily basis, and using that information to guide intervention, to guide who gets resources. And the referrals that Michael was talking about are really exciting, and the next step and the responsibility of government, as I see it, is to look at the data that we have and affirmatively reach out, identify who benefits from the kinds of interventions that will actually address gun violence, and focus on building relationships and supporting those people, supporting their loved ones and families to make different decisions, to show that a different life is possible. So it's really important to be ambitious and to set specific goals around gun violence reduction, and for leadership of cities and in the communities where we all live to view this as an issue that's not only on the shoulders of police and not only on newly emerging resources going to community violence intervention, but a partnership that relies on every actor and every stakeholder that has a role in addressing violence. And increasingly, there's a recognition that police can't do it alone, and police have not been able to do it alone over the last many decades. And so many cities are developing new offices, commonly called offices of neighborhood safety, offices of violence prevention, that are, in the best case scenario, serving as an infrastructure for coordination of community-based intervention and to address silos in government so that there's more coordination within government as well. So those kinds of systems really benefit from engagement with residents so that they're designed in a way that's responsive to residents' priorities, and so there's a dialogue that can extend beyond political cycles and electoral cycles so that over time there's change happening in communities that can be sustained and is not politicized. So one of the challenges in addressing local level gun violence is the importance of having a quick fix and the political pressures that elected officials face around addressing issues in the near term. And all of that is very important, but it's also important to ensure that there's a continuity of focus and of progress, and the best way to ensure that is to include and be responsive to residents and to community advocates. So I want to just close by reminding each of us that we each have a role to play, and the influence that we have around helping people find employment, helping people build out their capacity to support one another. There's workforce shortages and challenges around helping professions, right? And so one of the things that I think we can do is help equip people with lived experience to have the kinds of workforce development supports that other professions do, so that people who really have a passion for and are effective at addressing gun violence in communities have the kinds of support and infrastructure so that they don't get burned out, and so that they can continue this work over the long term, and we really build out a sector of professionals who are supported and valued in the effort to reduce gun violence. Thank you.
Thank you so much. And again, we're going to continue on our journey and go a little deeper. The first panel is going to be, and the reason I'm introducing him just a little bit is because A, he's a dear friend, but it's also has been an inspiration to me, is Pastor Gil Monrose, the founder of the 67 Precinct Clergy Council, and now the executive director of the Center for Community and Faith for Mayor Adams. He's going to be moderating our panel. It's a true treat to have him with us. However, just a little change in the lineup. A number of years ago, I got to hear a speech that Dr. King gave when he installed the new Cornerstone Baptist Church in Bed-Stuy. It was originally a Moravian church and is now becoming a Baptist church. Dr. King was apologizing for leaving early. He says, God has given me the burden of being busy. God has given Pastor Monrose the burden of being busy and also working for the mayor. So the mayor asked him to do something just the other day that he has to go out and stand in for the mayor at an event today. So he'll be leaving us partway through the next panel, but we'll be joined by his colleague and fellow pastor, again, Pastor Galbraith. As you heard before, he is not wanting for anything in his messaging. So I'd like to call up the panel with Pastor Monrose. We have Dr. Jeffrey Brenner from JBFCS. We have Dorian Karp from JWI, Sam Levy from Everytown, and Dr. Robert Gore. Again, all of their bios are with the QR code. Please take a look at it. And just, as they say, put those seatbelts on that weren't mandatory 50 years ago. Put them on for another part of the journey.
Good?
Yeah. They look good? Everybody look good? All right, good morning, everyone. Thank you so much, Robert Bob Kaplan. Robert Bob Kaplan, definitely, when I say that someone is a mentor, it's in true statement and fashion. I think he discovered me in 2008 in Brooklyn, in Flatbush. And the first time that I came into this building was on a Sunday with yourself and Michael Miller. You gave me a shout out. I will never forget that. So I'm going to shout you out every time I go to some place right now. And I was part of We All Brooklyn, the first cohort in 2008. And I remember that we were in Columbia University and we were discussing how do you make the news. And now I wish I didn't take that class, but yes, we did. But thank you all and good morning to all of you. As he said again, my name is Gil Monrose. I'm the founder president of the 67 Precinct Clergy Council called the God Squad, a group of pastors in the 67 Precinct of Brooklyn who decided that we wanted to do something around gun violence. The way that I got into this work was that I was at my church one day and a young man was shot and killed on the same block, and that's how I got into gun violence. There was no need. I didn't have any inkling about gun violence. I was not going on a journey. The Lord didn't come down and say, you need to go into gun violence. It met me at the church. And so ever since that time, my first funeral back then, here it is now as the national convener for clergy for safe cities. We have trained over 500 clergy members in urban cities across America on the clergy-led base prevention methods on gun violence. So it's good to be here. So we all ready? All right. So give us your best shot. So what we're going to talk about today is not just about mental health, but we're going to talk about the hidden effects of gun violence. And so a lot of times that we talk about gun violence, it is there. I think that there's two types of violence in America, two types of gun violence. We can talk about the mass shooting, which is great. But if you live in New York City, I want to tell you that the deadliest precincts in New York City has been the same for the past 30 years. And why is that? It's very simple. Where did you have the lowest census return? You had the highest COVID death. After COVID-19, after we cycle out of it, where did you have the highest gun violence? It's the same place where you had the lowest census return and you had the highest death in COVID-19. You had the highest gun violence in New York City. It has been so for the past 30 years. So this is not rocket science. This is very simple. If you see a problem, you triage the problem. When we did COVID, we put together a team and we only dealt with cancer. No, we dealt with COVID. Yep. Hello, right? So if you want to deal with a problem, what do? You look at the problem, you see where the problem lies, and then you go and then you triage the problem. Is that correct? Am I fair? Anyone that's talking to me today? Anyone? Is that right? At least I have one preacher in the house. So let's talk about the hidden effects of violence. Tell us what you see in your work and how you would lead us into this discussion as we begin. To frame the evening this morning correctly, so that when people hear about what we're talking about, they are clear on the violence in which we are talking about. Thank you so much.
My name is Jeff Brenner. I'm the CEO of the Jewish Board. We're one of the largest mental health and social service agencies in New York State. We're in all 5 boroughs, serve about 45,000 New Yorkers every year. I'm a family doctor, and I spent about 20 years in Camden, New Jersey, which is right across from Philadelphia. It's was for many, many, many years running was the poorest city in the country, and I lived there for much of that time. So both in my practice day by day, I saw kids, adults, and delivered babies, and I saw patients in a small office, and living in the city as well, had a very intimate, up-close view of this. Much like you, I got really deeply engaged in it when a Rutgers University student was shot and killed in the neighborhood, and I sort of got called by a neighbor, ran up on the scene, and ended up doing first aid and CPR on the victim, and just got, you get pulled into these things, and you get more and more deeply pulled in. There wasn't a week that went by where I didn't take care of someone who had been beaten up, shot, or stabbed, or a family member of someone who had been beaten up, shot, and stabbed. And the thing that really jumped out to me, I ended up learning a lot about trauma and the multi-generational effects of it. But the thing that really jumped out to me was the story from many of the families of family members themselves or relatives who had been beaten up by the police and had had evidence actually planted on them falsely and had been falsely arrested, falsely convicted. And, maybe I grew up very naively, but you don't believe everything everyone tells you. And, I was sort of at first very dismissive of the stories in my own head. I didn't say anything, but I'm like, social order can't have broken down to that point. You just don't want to believe that that could be occurring, or maybe that's just one or two examples. But the stories just kept coming out, and then over time, there were a whole lot of police in Camden arrested and convicted of planting evidence and a whole variety of things. And really what was happening is it was a department in crisis and utterly out of control. And over time, I ended up learning more about policing than I ever wanted to know. Ended up as one of 2 local citizens on a local commission to reform the police department. And a whole lot of folks from New York City, from Bratton's reform of the New York Police Department, came down to, quote, fix Camden for the 7th time. We'll talk about it. Oh, okay. Yeah. So the end of the story is the Chris Christie, the governor at the time, with the collaboration of the city and county political leaders, fired the entire police department. It's never been done in America. They actually disincorporated the police department, reincorporated a new department that was a county department with a metro division, a Camden City division. So there's only one division of the county police department was Camden, and only half the officers got hired back. And crime went down. Satisfaction by the community with their policing went way up. Through COVID, the city was much calmer than a lot of other places. And I guess the bottom line I would say is from all of this are 2 things. One is the clearance rate for crimes, for very serious crimes like homicide, was less than 18%. So that means 80% of people who committed a horrible crime in Camden got away with it. And the impact of that resulted in people arming themselves to stay safe, and the sort of escalation of conflict and sort of how horrible that is. And the second piece of this is that police departments are just organizations that have call centers called dispatch. They have motor pools, they have HR, they have rules and regulations and structure. And it all seemed kind of mysterious to me coming from the outside of all this. But as I learned more, these are just boring, failing organizations with no accountability that are running amok. And we don't need to defund them. They just need to be managed well, and they need to be regulated. And that's the unions are running amok. The police unions are running amok. And, you know, if we really want to get a portion of all gun violence is really derived from unaccountable, poorly run police departments. And we have to develop a much more sophisticated and nuanced societal discussion about how we move that agenda forward and how we make these organizations accountable. So let me pass it over.
Yeah, good. You should write a book called Running Amok. That'll be good. Dorian, you're next.
I would read it.
But we're coming back to some of that good stuff, okay?
Hi, everyone. My name is Dorian Karp, and I'm the Director of Policy for Jewish Women International. We were originally B'nai B'rith Women, so we've been around for a little while now. And over the course of the last few decades, we really changed our focus to work on the intersection of gender-based violence, domestic violence, and gun violence. About 25 years ago, one of the members of our organization was murdered by her husband outside of the NIH, her place of work. And that really refocused us to not just talk about all of the issues, which we still focus on, that are thought of as women's issues, but really to think about violence and the impact of violence on women and in the community, in the Jewish community. Last summer, so almost a year ago now, which is crazy to think about, and we created the Jewish Gun Violence Prevention Roundtable. Members are JCRC, who are here today. Menachem Creditor is a member for Rabbis Against Gun Violence. To really convene the Jewish community to take this on, to take on gun violence. You know, I've been talking to a lot of members of the Jewish community over the last 5 or 6 years that I've been working at JWI. And a lot of people think that it's not in our community. You know, we heard that there are obviously communities that are just proportionately impacted, Black and brown communities in our urban centers and across the country. But it happens in Jewish homes. It happens in Jewish spaces, at JCCs, obviously at our houses of worship. And so it's a Jewish issue. So first I just wanted to put that out there. I know I'm here to talk about gender-based violence and suicide and the hidden impacts of gun violence. But I want to make sure that we are acknowledging that it's our issue too. We heard about from the CEO of Northwell Health 2 experiences that he named of domestic violence. One in the pediatric unit, right, and one outside in the car, or outside the car in the garage of the hospital. So we know that this is a hidden impact that I don't think we always really acknowledge or think about. Often we think about domestic violence as something that happens outside of our purview and it's hidden in our homes. But it's a huge problem, and 4.5 million women are threatened with a gun that live in our country. And when there's a presence of a gun in the home, it's 5 times more likely that someone will be that a survivor or victim will be shot and killed by their partner. Another hidden impact of violence that we don't see, which we heard named earlier, is suicide. Right, so 54% of all gun violence and gun violence fatalities in our country are by suicide, and we don't think about that often. And it's really important that we center that, I think, in our conversations. You know, we heard about the intersection of mental health and gun violence. And I think it's important to think about that the biggest intersection there is suicide, right? So we're talking about folks that have major depressive disorder or other things. And so just want to make sure, you know, we don't hear about that. We hear about the mass shootings. We sometimes hear about the domestic violence. We hear about child safety and accidental shootings by youth and young people. But rarely talk about suicide and how that impacts families. And we're going to talk about trauma on this panel, I believe, and want to make sure that, you know, we're centering that in our conversations as well.
Yeah, thank you. I want to shout out Amy. You were in my 2008 We Are All Brooklyn Fellows. All right, it's not Amy. She's here too as well. The first cure of violence, I think, in Brooklyn. So good job, Bob. All right, Dr. Gall.
Good morning, everyone. My name is Rob Gore. I'm an emergency medicine physician in Brooklyn, New York, and I'm the founder of the CAVI program, which is Kings Against Violence Initiative. And CAVI is a hospital, school, and community-based violence intervention and prevention program, really focusing on reframing this entire conversation around violence and trauma. We see patients who've been injured who come to our emergency department at Kings County Hospital. I actually work very closely with Pastor Gill and Amy Allen Bogan's, I guess, former organization that she still is connected to. That's the Cure Violence Program, Neighbors in Action, formerly the Crown Heights Mediation Center. But in our hospital program, we work with people who've been patients. And in our hospital at Kings County, we see over 300 clients per year. I do want to kind of change the scope a little bit. There's a lot of talk about gun violence, but I've been an emergency physician for over 20 years. And all of my training and work has been in places that have been underdeveloped and underfunded and underserved. I did my residency training at Cook County Hospital in Chicago, and I came back to Brooklyn and been practicing in Kings County for almost 17 years, which is across the street from my elementary school, which happens to be situated in a neighborhood and in a community.
2 blocks from my church. Put that in.
2 blocks from the church.
Yes, sir.
Pastor Gill and I have been having this conversation for close to 20 years about violence prevention in the community. But reason why I say I want to change the scope a little bit is because there's always this conversation about gun violence, gun violence, gun violence. And from my perspective, it's really trauma. Yeah. One of my very close friends and mentees was stabbed to death. Does that mean that his death was in vain? No, it just means that's another aspect of trauma. And trauma itself is something that we consider based on an injury due to some sort of external force, but we know that trauma is much more than just this physical process. It's a mental process that's brought on by both physical and psychosocial stressors, which impacted by everything from poverty, education, or anything what we refer to as social determinants of health. And so I think it's important that we do focus on gun violence as a specific section, but really pay attention to the larger umbrella about trauma, because if we don't, we wind up missing things. If you look at, homicide itself, not gun violence, but homicide itself is the #1 cause of death for black men ages 15 to 34. Not suicide, not accidental injury, which just as other populations. We're talking about death because of someone's intention, whether it's been due to blunt trauma, whether it's due to some other form of penetrating trauma, a knife, razor blade, you name it.
Could you repeat that stat again? That's the leading cause of?
Homicide is the #1 cause of death for black men ages 15 to 34. And if you look at the CDC's chart, it's actually up to 44, but if you break it down a little bit, it's really down to 34. It's the #2 cause of death for Latinx males ages 15 to 34. So this is intentional trauma. But if you break down the risk factors for who are the patients and then who are the perpetrators, and even just break it down even further and just kind of take it over to the realm of mass shootings, all the same things. Having easy access to weapons, doing poorly in school, poor social support systems, mental health issues, gang involvement. It's all very much the same thing. But I bring up these risk factors and paying attention to a lot of psychosocial issues, even taking it up to another space, the adverse childhood experiences, different forms of physical and emotional abuse, having a relative who's been incarcerated in the home. These are all things that are contributing factors. And because we all pay attention to the sexy stuff, which is there's a shooting that's taking place, there's a shooting that takes place, which is important as I forgot our young speaker who spoke from the Vera Institute. But there's much more. That's the intervention part. The preventative part is the long-term process that we need to garner more support from, which is why having this multidisciplinary team from our clergy, from our community-based organizations, from our brothers and sisters from the Jewish community in Crown Heights and beyond. I see a Muslim brother here, but having a really comprehensive approach, incorporating this biopsychosocial attempt to engage and transform healthcare, this is how this winds up taking place. The transformative elements that are essential for community overall health and well-being have to be multidisciplinary. They can't just focus on the intervention, but looking at the prevention. And the prevention is improving the qualities of education, bringing in funding to make sure that centers stay open, making sure that there's adequate health care access. It's not just one thing. We like to make it one thing, but it's really all the same thing. My patients, deal with HIV. I had a patient that I took care of was it yesterday? I'm having a brain fart. I have a 2-year-old, so I don't sleep very well. But I had a patient on Monday morning who was a sign out. He was undomiciled and was staying in a shelter and was supposed to get a COVID test to be cleared to go back. Once he got his test back, it was negative. He said, I can't go back to the shelter. I was like, why can't you? He said, these people are trying to kill me. I'm like, what do you mean they're trying to kill you? He said, I have gang affiliations, and I look at his chain, and he has an M16 chain around his neck, and he's got tattooed teardrops. He's also paranoid schizophrenia. HIV, COVID clearance, undomiciled, a victim of violence, a perpetrator of violence. He has all of these different things wrapped up into one person. So you can't avoid targeting one issue without really engaging in the others. And so I'll pass the mic. And thank you.
Yeah, we have a lot to say. I'm not sure what time is lunch, but we might have dinner. We don't know, but we have a lot to say. Yeah, go ahead.
Good morning, everyone.
I'm leaving, yeah.
My name's Sam Levy. I'm the Regional Legal Director at Policy and Legal Advocacy Research Survivor. My work is, we'll come back to that. Survivor doesn't mean you ask around the room, people. Is to think of it as and understand the data. Try to billions and billions of dollars. And continue to active policy solutions and access, right? None of those solutions mansion, but that would work math. Who are stepping here in New York.
All right, thank you so much. All right, so you've heard a lot. Could someone stand to repeat everything that was said from each person so that you're clear? But this is very important. I mean, if you look at this paper that you have on your desk on the table, I had so many corrections to all of the statements that was made. Number one, if you go to the back, gun violence in New York ranks 47th in the rates of gun violence among the 50 states. These rates does not happen by mistake and are largely due to having the second strongest gun laws in the country behind California. Half truth. It is because of what you have seen today. Clergy working together with anti-gun violence groups, with people who are helping social programs. Those of you I want to say, I have a lot to say, but I have to leave soon. I want to say to you as well, when you listen to everything that have been said, those of you who have the ability to fund organizations who is doing work outside of what you would normally see, if you have someone, again, who have an application that is totally, that looks just like the young man that you mentioned, if an application looks like that, not like me, like that, but in terms of all the things that you're seeing, these are the groups that you need to fund. Why? Because these are the people that is closest to the problem. And so what we have to do in this conversation too as well, we're thinking through the issues of domestic violence. So to help gun violence work, it takes a different level of support for different situations that we have. Domestic violence. You talk about helping police become better departments, helping, again, individuals with health care, and also to working on laws that can really make a difference and make a change in our communities, right? So those are some of the things that as we work. So when we talk about trauma, I think that all of us in here have been traumatized today, in the sense that we're hearing stories, we're secondhand traumatized. Clergy, you're traumatized. Doctors, you're traumatized. Those of you in the boardrooms are traumatized. If you look at all of the trauma that we face, how do we deal with trauma in a positive way that help reduce the violence? And even ourselves, how do we use our trauma for positive to reduce the violence that we see? Now, if we're going through the line and at 11 o'clock, I'm going to stop and say I'm going, and then you keep on going, okay? All right. Thank you so much. Right. So is there any time for question and answer? Okay, could I let me do this really quickly. Let's take some questions. Do any question based on what was said here, so that I can get my whole panel in by 11? Any questions? Go right ahead. Good morning.
I was invited here because I'm president of the Senate. Gangs, but drugs and control, and the inability of the police to get people to support. It was a Saturday afternoon. We know people know it was never a solved crime. So I guess my question to the panel, for not being succinct, I apologize. But my question to the panel is, where does police, drug, and community awareness come into our challenges?
Yeah. I'm sorry for your loss as well.
My condolences to you and your family on this very auspicious day for you. I grew up in pre-gentrified Brooklyn. I went to junior high school on Myrtle Avenue in Knickerbocker, right around the corner from where the incident took place. And I started carrying razor blades when I was 10, 11 years old because of being jumped and mugged around that area in downtown Brooklyn. As a person of color, as a black male, I've been taught to fear police. I've had run-ins with the police since I can remember. I was always taught that you have to be careful around the police because they're going to assume that you're somebody else. They're going to assume that you're not who you say you are because you look older than you are. So my engagement with the police and some of our other members up here on the panel, Pastor Gill has a very different relationship because of the 67th Clergy Council, and they've been doing a lot of mediation work with law enforcement. I think the number one thing that can be done is augmenting levels of support. Why do people use drugs? People use drugs because they're looking for some sort of self-medication to mask the hurt and trauma. My brother's an IV drug user and has been hospitalized and in and out of institutions because of IV drug use. And he's had a lot of hardcore pain and trauma that has existed. The role of the church, and Pastor Gill and I had a conversation about this very over a decade ago, which makes me feel a little older. But what is the role of the church and religious institutions? Religious institutions are very close to the communities. People are dealing with a lot of hurt, but people coming from many spaces aren't as comfortable going to formalized counseling and therapy. We've been taught to fear the medical systems. And so religious-based institutions incorporating pastoral counseling is probably one of the easiest things that can be implemented. Now, you're also going to be dealing with a vulnerable population that not everyone at your respective institutions is comfortable with speaking with. So having members of other members in the community who are more comfortable to join and have this multidisciplinary team may be a start. Don't focus on the drugs. Don't focus on the violence. Focus on augmenting the support. That's the key, because if you don't have that support, you can talk about drug interventions all you want. You can talk about violence prevention all you want. But if you don't have basic needs of support, food, clothing, shelter, security, and security, not even just talking about physical security in terms of arming yourself, we're talking about mental security. All this stuff is going to be a moot point, and we're going to keep running around in circles. So augmenting places with comprehensive support, multidisciplinary teams, having somebody who may understand drug treatment, I think would be a very powerful thing as well. But utilizing pastoral counseling services, utilizing community mediators as a way. If you got a group of elders from your synagogue and sat around and had members of the community who have been dealing with trauma and just talk to them, technically not. It's technically group therapy, but you don't have to call it therapy. It's really paying attention to what people have to say and hearing them first and getting firsthand what they might need.
Yeah, everyone will take a step. Yeah.
I'd say, I think, again, thinking about the moment of tragedy, right? You see that it's about prevention, right? It's about looking the people. And to your point, how those communities view gun violence, there are real concerns in those well-founded. Again, these are often over police. That and part of the actually is doubly counterproductive because these officers want to feel in their community, but building that trust is vital, right? Communities that are willing to reach out and see. That treat communities with.
Yeah, thank you. We're going to have more discussion. You can chime into it as well, Dorian, and Jeff, you can do so as well. I'm out of here. Thank you so much. Yeah, you're welcome.
Welcome to the panel.
Good to be here. So as we first greetings everybody, and thankful for the reflections and engagement we've had already. We'll talk about trauma in a moment. I know Pastor Gill did open it up for a few questions, so we'll do that and then come back into our reflection in this moment. So any other questions? I'm seeing our brother here.
Good morning.
Coordinator for.
Speak up.
Can't hear you. Sorry. Can everybody hear me now? Better? Good morning, everybody. My name is Seko. I'm the parent coordinator for CS55 in the South Bronx. I hear sharing stories with everybody because I don't want to make the room more sadder. I'm a victim of all those three things that you guys have mentioned in the South Bronx. My brother got stabbed in the chest 2016. My cousin got shot in the chest 2016. My cousin got shot in the chest 2018. I think roughly 55 days ago, my cousin shot himself as a suicide. 21 years old. So I'm just here to just represent the South Bronx. It's been, record as one of the high victim of suicide and, gun violence and a lot of drug. Every block I have 3 smoke shop in my neighborhood. So I've been there for 15 years. So trauma, yeah, I understand you very well. I'm trying. I just wanted to know, this room seem to have, of course, a lot of resources. I just wanted to know what you guys are doing on that side of the South Bronx because I'm involved a lot in a lot of leadership meetings. In obviously work for the DOE, so we know a lot, but it's we're not heavy on gun violence. And I would just like to hear from you guys if you guys are thinking about us out there.
I guess as one of the violence intervention programs in the room, we don't have programming in the South Bronx with our institution, but there are some our partners who work in the South Bronx. There's SOS, which has actually grown out of the Crown Heights Mediation Center. Their location is in the South Bronx, and that's headed by Sister Ife Charles. Amy, is Ife still? Actually, Amy just stepped out. Ife Charles is a major force out in the South Bronx. There's also at Lincoln Hospital, which is, I'm not sure how far that's away from you. Brother James Dobbins, we call him Jimbo. Jimbo heads Guns Down, Life Up, which is another program that's based out of Lincoln Hospital, providing violence intervention and prevention, not just with patients in the emergency department, but supportive programs for young people in the community of the South Bronx. There are a whole host of others, and the good news is that we've really helped augment the movement. But there aren't as many visible partnerships with some of the local schools. And so I think that might be something to touch base with. If you go on, I forgot the website, but if you just Google SOS, which is Save Our Streets, in their South Bronx location, touch base with Ife Charles and some of their team members, or James Dobbins with Guns Down, Life Up, that might be a great support system for you.
I follow stories on the confidential coordinator at the attorney's office, for the DA's office. They work over at I know Jimbo. So long story short, you work in the South Bronx, live in the South Bronx, also work in the South Bronx. I can definitely connect you with the 5 Cure Violence organizations. I know for Guns Down Life, for an example, they're having anti-gun violence youth employment program. Our office is also going to be doing the youth summit. So he has my business card. Let's talk. Anybody has any questions in regards to the South Bronx? I'm your man.
I want to just talk for a moment about access to mental health outpatient therapy in New York. We take care of about 15,000 New Yorkers every year, about 250,000 counseling visits, and so that's good news, right? And the stigma to getting outpatient therapy has gone down. So there's more and more norming across society that it's okay to go and get therapy. The negative side of the story is we have a waiting list that's more than 2,000 people. So New Yorkers are calling for help, and we don't have enough services to provide. The bottleneck for that are social workers. It's qualified, licensed mental health therapists who want to work for New York agencies. So all over the city right now, there's a lack of social workers and lack of licensed mental health counselors. We're competing. So you can go and be a private therapist and make $200 an hour. You could go and work for one of these startups that are online and make a lot more than all of the agencies in New York that are able to pay. So that's a real struggle. So that's the struggle. Let's talk about a positive piece of all this. All of our services used to be in person, and we had offices all over the city, and we had a very high no-show rate. People get out of bed and, really don't want to, don't necessarily want to show up to their counseling appointment. 70 to 90% of our services now are online. That's amazing, and that's a real pivot. And the city, state, and federal government are now allowing us legally to provide therapy and psychiatry services online. So that's great news. That means that if you were a victim of violence, you're anxious to go outside, you now don't have to leave your home. You can get services in the safety of your home. So there's a good news story to all this and a bad news story to this. And hopefully over time, our payment rates catch up and we're able to pay social workers what they deserve to be paid, and we're able to catch up on some of this backlog going forward.
As a former social work intern at JBFCS, I can attest to the challenges of social work and the important work that it holds in the city and across the country. I just wanted to lift up. We've heard it in bits and pieces, but I just want to really centralize that most perpetrators of violence, whether it be gun violence or other forms of gun violence, are victims, survivors themselves, right? Whether we're talking about family violence, so domestic abusers who witnessed interpersonal violence in their homes when they were young, child witnesses, or actually had harm perpetrated onto them, or we're talking about in these communities, right? And growing up with the sirens, the police force, seeing their friends killed, and what it means then, right, to be perpetrating that violence. We heard about the young man that had the teardrops, but also was obviously a victim himself. And so when I heard the story of your husband who was murdered, I was thinking, as a former social worker, like the individualized part of that, like who was that perpetrator of violence? What led them to take that, to make that terrible decision and act of violence? And, you know, most likely if they were, you know, drug use, all of the things, right? Like they were experiencing trauma themselves and then perpetrated it onto you, your family, your community, our community. So just want to really, you know, people are their full selves, right? And we have good parts and bad parts to us and what makes us perpetrate harm, and the communal impact of that. And also as a policy person, right? Like all of the things that we can do to support folks to find other ways of healing, or find ways of healing before they're perpetrating violence. We're about education, housing, mental health services, like healthcare access, like all of the things that we think about when we're not thinking about in the gun violence debate. We think about policies, right? We think about like background checks. We think about extremist protection orders. We think about banning assault weapons, right? But for most of us in this room, we're not thinking about housing insecurity. Which is, you know, and so I think we have to be expansive in how we're thinking about prevention and response to this problem.
Yeah. And it brings into focus, I think, the intersection of what we talked about earlier, which is mental health and something bigger, right? Mental health is I'm not a doctor, but it's a defined term, right? It means you have a diagnosable mental illness, right? That is not the driver of violence broadly or gun violence. You know, illness are more likely to be victimized than they are to be perpetrated violence. But we're a society that is us, right? We are people who are increasingly isolated in many respects. COVID didn't help. There was mention of social media. There are pieces that are ourselves up, how we support ourselves that are one. Per se, there's something about those are the things that when set the stage for
Go ahead. Regarding mental health, I think we just have a lot of undiagnosed mental health in our respective communities. You have somebody that's witnessed to trauma or experienced a trauma, it's normal to have an acute stress response, and that can last anywhere from 0 to 3 days. Those symptoms, and that's like headache, nausea, vomiting, heart palpitations, just feeling stressed, the sense of impending doom. From 3 days to 30 days, that's an acute stress disorder. Many of our patients and people in our communities, even our own family members, will go through those symptoms. And those, again, same kind of symptoms based on the same triggering event. If those symptoms last beyond 30 days, that's PTSD, based on that same triggering event. So if we analyze a lot of the people we've come in contact with, you go, wow, I know people who have all three of those. But then on top of that, you have something else that's been introduced. They can have pre-existing PTSD and a new acute stress response because of some trigger coming in contact with police. And so that just increases all these things until the person explodes. So mental illness and mental health challenges, we all have different symptoms related to these things, but once it comes down and has an impact on the way you carry out your day-to-day life and responsibilities, going to work, taking care of your family members, going to school, just getting up to eat, when those things are impacted, that's when it becomes pathologic. So we have to. I know people like to say, "Oh, there's no mental illness tied to homicide, or it's a small component." It's a lot larger than we like to see, and it's mental illness is hidden. It's not like when you have a physical manifestation of a disease, and you can say, "Oh, wow, that person has a cancerous growth on their skin. That person has a broken leg. I can see how they're walking with a limp." There are a lot of things that people have been trained, particularly people who are coming from marginalized spaces, because we're taught to hold your head up. Don't make a fuss. If you say something, then people are going to hold it against you, and then you're not going to be in a position to take care of yourself. So there's a lot of hidden mental health issues and challenges, and so I want to make sure that we don't say, oh, it's not as big of an issue as it is, because probably 90% of the patients that I take care of with random things in the central Brooklyn community have some sort of underlying mental health issue. It just hasn't been diagnosed yet.
thank you for those reflections and those insights. I always have to say this as the husband of a social worker. I really do appreciate the work and the frame of approaching it from a holistic framework of ideas and perspectives. I wanted to also note, I'm not Pastor Monroe's, but I want to kind of flow in the same vein, in the sense that there's something unique about this panel because you're coming to it from an interdisciplinary perspective of where you're addressing, and we're addressing and connecting and seeking to serve those who are coming with an intersectional framework of multiple things taking place at the same time. For those of us who are practitioners, for those who are in this room, how do you develop these partnerships, and how do you recognize when you need to go outside of your particular field to get assistance and direction?
I've had to go out in my field for most of my career. Again, most of my mentors were in other states, in other cities, because there weren't many physicians of color that you can kind of go to. So you're just happy to see one, whether they were in your field or not. With violence intervention, again, Pastor Gill and some other people in this room have been doing this work for close to 20 years, and we were reprimanded. We were pushed away. People would like to say, "Oh, this is kind of cool that you're doing, but we're not going to support you." And so we've always had to go outside of the environment. Medical professionals, if you look at this business itself and marketing, if you're pushing any sort of device, the medical community are usually late adapters to anything. Technology, that's why we still, in some places that I'm sure you're very familiar with, and I'm sure you're even on a policy front, I'm sure you're just as familiar. If you look at how many paper records that people still keep, in 2023, you go, oh, wow, okay, how come people haven't adapted to things? So this is the story of what we do. Having a list of helpful people are helpful people. It doesn't matter if they're in your respective space. The goal is to get things done, and getting things done, you have to have some sort of support and to really develop a coalition. So having conversations with people from the clergy. If you have a like-minded person who's interested in this stuff, it's like, cool, I'm just happy to have somebody who agrees with some of the things that I'm saying. You might have somebody in education doing the same thing, partner together. Our violence intervention program and preventative program, our first programs were launched in the New York City public schools because I got a lot of pushback and slack from my own institution. I work at a hospital that's been dedicated to taking care of people's lives to help save them, but we couldn't get support for over 6-7 years, and I wound up doing a grassroots at first and took it to the schools just to make things done. My father's also an activist and met Dr. King as a high school kid and was mentored by C.T. Vivian. So change and creating change is very important to just our family. But you have to go to like-minded individuals, and who cares if they're not in your respective field? If they have an interest, if they have some connections, build on that stuff, create a coalition, and continue to build. Engineering design process teaches us to think that we have a problem, you identify a problem, come up with a potential, brainstorm a couple of different problems, take a prototype from that particular those things that you brainstorm, then execute. Test that prototype, and you go back and see what have we done, what worked, what didn't work, and how do we go back and do it better, stronger, and more efficiently the next time. It's a cycle. But if you keep thinking that I have to stay within my respective lane, within my space, you're going to miss out on a lot of things. One of my students was an engineer, and he taught me about engineering design process. I was trying to create something like that, and he was like, why are you trying to create something that already exists? Look at this. And I used that as a prototype for not being hindered by mistakes. This is engineers, and I'm not sure if there are any engineers in the room. This is how they think. How do you do it better, stronger, faster, more efficiently? That's almost a mantra that they take on. So who cares if it's not somebody in your respective space? If they're a willing participant, that's somebody that you can go with. As long as they're honorable, then you can go with that person and work with them.
And I think a lot of it is our experience. I've been in every town. Here's it started as a project in Mayor Bloomberg. All is really a political organizing tool. Mayors against illegal guns. In the time, but we've evolved in ways that are vital. Started and we do now, right? Whose whole job is lifting up and partnering with and identifying community-focused solutions, right? Violence intervention. We did survivors team whose whole job is lifting up survivors and their families and giving them. We're not that big an organization, but you know, the work is to do the best you can in the space you provide at this point. But like, it doesn't matter that much if they're not fully and fairly enforced, right? So when it comes time to do that, I want to talk to law enforcement. I want to talk to the Office of Gun Violence Prevention about, like, do people understand that this law exists, right? Like, that work matters, but if it doesn't go out the door and people don't know what a red flag order is or how to go get it when they see someone who's in crisis, then the value's not there. So a lot of it is, and again, there's this question of, I saw the ad from Northwell, like, there's a stigma largely around talking about a lot of this stuff. Taboo for some reason, and I work in spaces, there are states that pass laws to prevent doctors from asking about guns. It's like so deeply backwards, but it's a reality because everything that's done on one side of this moment has to be met with counter response. So you can't, of course, it makes all the sense in the world if you're a pediatrician to ask if there are unsecured firearms in the house because firearms are the leading cause of death for children. School shootings are driven by guns that are obtained from homes or friends' homes. Like, it's not rocket science. We know how these things happen and have to drive solutions that way. But that's the education piece. That's the reaching out and saying, like, here's the website has tons of cool stuff. Go check it out. If you want to know more about the problem, the data's there. If you want to know about the solutions, there, and knowing that you have partners like the people in this are willing to lift up, offer their services, right? Like, my expertise stops somebody else's begin. Everyone working in.
And shout out to Everytown. I mean, they are like one of the biggest leaders, right, in this gun violence prevention movement. And JWI, I sit on an interfaith advisory council that they created a few years ago, right? So they were engaging faith communities. A few years ago, they brought me and a big group of domestic violence policy experts to talk with their researchers, and the researchers go to conferences on domestic violence. So they're everywhere, right? They realize, and like a lot of movement leaders, that like they can be experts in certain things, but not in everything, right? And in the domestic violence space, when we were working on closing the boyfriend loophole, which allows perpetrators of dating violence who were convicted to have firearms federally, you know, we had to engage, of course, the domestic violence community to get them on board, but we had to get Everytown on board, and we had to create talking points that were, you know, and Gabby Giffords and all the other organizations, and then the chiefs of police had to get on board because responding to domestic violence incidents has the greatest fatality for them, and really making sure that the tent is big, right? I think coming together where you can is incredibly important in forming these coalitions and authentic relationships, right? Really where you are in support of each other and have a dialogue back and forth, not where you're using individuals or organizations, but really creating those relationships is key.
I want to talk a second about this collaboration point. I think it's really critical. I was so excited by my collaborations with the mental health field, with social workers, that I joined the field. So I'm a family doc and now work all day long with folks in the mental health field and social work field. One of the reasons I got so excited about it was what you mentioned earlier about adverse childhood experiences and our knowledge about trauma. There's just a growing body of really high quality research in the mental health and social service field that enables us to have impacts on people that were unimaginable previously. So in many ways, I think the public has often thought of mental health and social services as a kind of a black box, and we throw resources, we throw money in, but we don't really know what the outcomes are. That's not true anymore. The same rigor that we use to test drugs, randomized controlled trials, and all the science have now been applied to the field of mental health and social services. One of the best examples I have of that is if you turn the clock back 30 years, 70,000 kids a year in New York City were taken away from their families by the foster care system. And that's tragic. It's tragic for the family, tragic for the kids, and the city didn't have enough places to put all those kids. And if there's any group of kids that were going to go on to either be victims or perpetrators, it was that group. Now the city takes about 7,000 kids away a year. Amazing. That's an incredible success story. It's probably one of the greatest achievements of the Bloomberg administration. The way they did that is the application of 4 mental health evidence-based models that were rigorously tested and developed. And we are vendors to the city, and we run those 4 models, and other agencies do as well. And our teams go in and work with incredibly at-risk families and keep the family together. And they work the kids and the parents to learn new parenting skills, new approaches, how to adapt and cope with trauma, all of these different things. When the clock goes forward 30 years from now, that will end up being the critical linchpin in the future of New York to prevent violence, because if, those are the crucibles where this violence starts, and this is breaking that cycle right in the house. Our teams go right in and sit with the families and, talk about why they're yelling at each other and what they can do to change that. We take referrals from those programs, not just if you call and make one of those anonymous calls that you think a kid is being abused and neglected, but families themselves can call and refer themselves with no stigma attached. Pastors can give them the phone number. Pastors can call. So we take direct community referrals as well, and all of the organizations that run these models do as well. So I think it's a hopeful note of, collaboration really does make a difference, really does mean something.
Thank you for sharing that, and thank you for even that specific example of what we're sharing, because I think I'll get to the next question. But let me just speak into this as well. For me, serving as a faith leader and a pastor in Central Brooklyn, East Flatbush, several things that you've already lifted up have come to be true as part of our community. The reality of folks being more open towards conversations concerning mental health has been present, not necessarily many times in the healthcare providers, but with us as clergy, that they will come. And so what's been helpful for me is I know what I can do, and I also know my limitations, that I can offer pastoral counseling, but because I'm married to a clinical social worker, I also know that there are limitations in regards to my capability and capacity and insight. And so having trusted individuals who we can refer to, who can actually, we've been working and trying to do this where they can come and meet in those faith spaces, because sometimes even the transition from the faith space to the institution can be a bit challenging. We see a drop-off rate in regards to folks following through. It's helpful to be able to work and serve on the board with SUNY Downstate, to be able to see when a situation happens, when there's a crisis moment within a family, to be able to have access and be present in that space, as well as working with other organizations, clergy organizations, as Pastor Monroe's shared with, concerning legislation as well as advocacy, to recognize and realize we're not just addressing the immediacy of it, but also looking what are the causalities and effects that are lifting it up. So with that, listen, you already know, you heard me speak before. I'm coming from a faith perspective, so I'm going to ask this question from you guys. What does it look like for, first, what is in your respective fields and areas, what does healing look like, and what does wholeness look like? I think it's a good question because I hear y'all breathing.
Healing. Ooh, I got to think about it. Healing itself almost requires the absence of a disease process, and that can get an individual to a point of functionality. Wholeness is a lot more comprehensive. That's a state of balance. And if you're looking at balance, it's, like I look at the body itself almost as a scaffold. You can have a scaffold that's up, that means it exists, but if that scaffold is a little bit off balance, and you start adding more and more weight to it, it's going to collapse. And that's almost like what we call allostatic load. And allostatic load is really pathologic. That means your body can no longer respond and really tolerate these states of stress. So looking at wholeness itself is really not just, is moving beyond healing from a disease process, but you alluded to something a little bit earlier, being adaptable to situations, to adverse circumstances and conditions. I think that is the goal. Not resilience, but adaptability and transformation and evolution.
Great question, by the way. So, individual healing, right? There is a lot of, I think of this thing as a broad scope. Like I look at types of things of data of aggregates, right? But obviously these are people. Traumas is families. Some of that is is just censoring that, right? The newspaper page and there's a mass shooting, like, ever, and I talked about this and the people that I work with, some of whom are truly facing work. I don't do that work. I get pushed. Okay. Have these calls and we deal with rapid response and we deal with tragedies every day. Stopped and dwelled in that all over, right? Like humanity requires you to have some kind of ability to analyze those things, to process it in a way, hopefully in a way that's healthy, but you can't live in it, right? But you have to be able to honor that enough and to give those individuals the space, support they need to process it and the collective, I think, the wholeness question is what gun violence is so different, right? What it means to be Brooklyn or the South Bronx is very different from what it means to be Syracuse or Oneonta, where gun violence is an older white male suicide problem, right? It's not a focused, small number of offenders, city gun violence every day. And the problem is, in part, that polarization has that the two ends are fighting. In fact, the problem is unitext, right? The problem, if you understood it well, is that there's no separation. Experience it differently, right? But there are people with a lot of money leveraging one against the other here and then selling products, right? That's the issue. So the wholeness, I think, is cultivating a sense that there is no separation between you. They are a collective thing. Like your wellness is my wellness. We all can strive for something better. And again,
I delivered babies for about 10 years in Canada, and so you get to know families in a really intimate way. So I guess my first thought to that is really it's when a parent breaks the cycle and whatever they were taught inadvertently, racism, intolerance, anger, violence, they break the cycle and don't pass it on to their kid. And then healing's really been achieved. It's such a good question. Yeah.
I like your answer better than mine, but I feel like I have to answer it because that's what we're doing here. I was actually thinking about like restorative justice, or restorative practices. That's what the question made me think about. In the domestic violence field, we often talk about how every survivor needs different supports. What healing looks like for them won't look like for the next survivor, right? And one of the things that we try to advocate for is to be able to support that survivor in whatever that looks like for them. So for a long time, right, it was use of the criminal legal system was the place you could go to find that healing justice, whatever justice means. And now we're thinking more expansively about how people heal. What do they need? What do they need from their communities? What do they need from their faith leaders? What do they need from their partners? What do they need, and how can we support them holistically as they move forward?
Thank you for those reflections, and thank you for wrestling with that and coming from it from your various perspectives. I think gave the holistic framework that we're looking for even here. So that's very, very helpful for us. We're drawing closer, but I did want to give an opportunity once again for those who may have questions from the audience to lift up. Brother Waterman, good to see you, my brother.
Good morning, everybody. My name is Eric Waterman. I am the co-founder and the executive director of East Flatbush Village, Inc., which is a youth and community development organization with the intent focus of preventing gun violence and gang violence in our community. We stumbled upon this work in our community based off the need. The need because we started out with youth sports and activities, and we realized that there were different traumas and challenges within the household. And we would work with the kids for 2 days out of the week, and it was like restarting every day they came back to the practices. so those traumas really existed. And for 15 years ago, when we started doing Occupy the Corner and being out in the streets with God Squad and Pastor Monrose and Pastor Galbraith, we did this work, and we were kind of thrown into it based off of the need of the community. And so we kind of embodied the title of today's session in terms of being a voice for faith and community, that tie. We have been doing it for a long time. The question I have to the panel is, as we've been discussing mental health, what preventative aspects are put in place to prevent gun violence through the lens of mental health? And the reason why I ask that is because even right now, East Flatbush Village is engaged with the Office of Mental Health Services, New York State Office of Mental Health Services, to do a mobile mental health trauma support in our community. Why? Because you mentioned some of those social determinants of health, being able to bring people to resources as opposed to trying to reach out to them. Most people won't step forward in their trauma and say, hey, I'm traumatized, I feel this way. They actually hide within that trauma, and then it gets worse. And outside of going to the pastor and maybe some other trusted members in the community, what are some of those preventative measures that are being placed in that regard? And I ask that in the lens that we're the first responders a lot of the times in our community, both on the mental health side and, of course, in traumatic violent situations such as shootings in which the community calls us first, and we're there when in response. And so I just wanted to bring that question forward in regards to the mental health side.
Well, I'll let the doctors speak to the meat of it, but the thing we know for sure is that whether it's a mental health crisis or any other kind of access to the firearm, right, if you're in suicidal crisis, if you're considering self-harm, suicide attempts involving a firearm result in death about 90% of the time, as almost the inverse for every other method option. And folks who attempt suicide and survive almost never, again, 90% of the time or so, don't go on to die by suicide. They get help, they get support, and they don't end up taking their own life. They get a second chance when there's. So for us, apart from, again, there's underlying causes, and the doctors can speak more to that than I can, the issue is access prevention, right? Storage in your home, right? Making sure your firearms are locked, unloaded when they're not carrying them, regardless of who's in your home. Many states' laws focus just on children, right? If you have a child in the home, there's certain consequences. New York does better than that now, when that's worked, that law has been expanded. And again, I think most responsible gun owners agree, right? Nobody wants their guns in the hands of someone who shouldn't have them, let alone children. So secure storage, thinking about flag laws, right, or both the extreme protection order, which is a temporary order that prohibits access to firearms, and is in a crisis, there's another step you can take to make sure they can't walk into a gun store and buy a firearm if they are considering law in New York State now, and has been since 2015. The law in 19 states, when Michigan and so there are those types of interventions, right? And those are literally just about access prevention, vitally important, and the importance of authorized access, depending on authorized access to firearms is.
And I'm going to leave it to the doctors who are doing actual work in New York to go to the question. But am I correct that the Bipartisan Safer Communities Act had a lot of funding for schools for mental health?
That was one of the features, yeah. I mean, it created a pretty robust set of crisis interventions. So again, for states like New York or taking other steps are huge pots of money available for organizations. But that was one of the great breakthroughs again last year, and
the perpetrators and probably a majority of the victims of gun violence are men, right? Not women. Like women, may shoot guns, but they don't shoot people with guns. And they're they are being shot in domestic violence, but the people shooting them are men. So we've got a guy problem here. And guys don't want to talk about their feelings, and there's incredible stigma for everyone for mental health that's lifting, but really for guys. And so how do we norm talking about your mental state, how you're feeling, your anger, how you're working through that? How do we norm amongst guys seeking mental health? Like, I think that sort of gets a little bit to the heart of that's the first thing that comes to mind in your question. And, I don't hesitate to put on my calendar at work, doctor appointment Thursday, I don't put, my therapy appointment on there. And I don't mention, to people, oh, I'm going to be up, at 4 o'clock because I have a therapy appointment. I may say, oh, I'm leaving early today for a doctor appointment. So there's just so many ways in which guys are not comfortable talking about this stuff. And we could go a long way as leaders of organizations, norming talking about it. So in my prior organization, I talked about it publicly a few times with staff, like, oh, I have a therapy appointment, or I'm going to get therapy. And that was very uncomfortable. I mean, I'm a family doc. I talk about, what your poop looks like every day. I'm used to talking about uncomfortable stuff. That was really uncomfortable. So, I think we need to norm this as leaders and talk about it with our staff and our family members and our friends and our guy friends, and hopefully that concentric circles come out from that.
Prevention is different at different stages, and you alluded to that as well. Prevention for a young person, and particularly males, is going to be very different from that of somebody who may identify as female. Biologically, look in the emergency department. Most of the people come in with injuries, and this is from the adult males to the adults to the teenagers to the little kids. The majority of injuries I see are males. They have a lot of energy. And as the father of a 2-year-old, my son is athletically gifted in climbing, running, anything. As somebody who, had I been born in a different era, I probably would have been diagnosed with ADHD. But I had a mother who was a teacher, and we modified a lot of things in the home environment. Athletics, sports, movement. Most schools are not designed for males. They're designed for kids to sit still and to follow directions. But if you have a kid, and then for all those of us in this room who are athletes, you have to move. And so it's repressive to keep somebody confined in a specific space and not be able to release certain amounts of energy, or at least just the form of processing. For people who may be considered neurodivergent, or people who just have experienced trauma, the body, was it Vanderkelk? He had the body keeps the score. I forgot it. I think that's the name of the book. Is Vanderkelk? Okay, thank you. Your body holds on to a lot of stuff, and so there has to be a release. The body itself likes to be in a state of homeostasis or some sort of balance. And if you're not able to dissipate certain things, it's going to wind up exploding. And it starts off in elementary school when you have the very active boys and some girls who feel the need to move, and they can't. So what do? You restrict their form of play. You can't go outside to play, which just creates a lot of other anxiety in that kid. So then that kid goes back home. And what do you do when you live in New York City and you don't have places to go and you're confined to an apartment and live in a neighborhood where there's a lot of violence in the community? You explode in the home. And as the son of a black mother and black father, you do certain things in the house that you're not supposed to do. There are physical consequences of that, which creates additional trauma. And so now you're getting in trouble at school for not sitting still. You're getting in trouble at home for not sitting still. And what's being done to dissipate these feelings that you have inside of you? And so the preventative part is really cultivating safe spaces for people to move. And movement can be just the relinquishing of moving of stagnated trauma that you have occupying, that you've compartmentalized in your brain, to the physical movement itself. But either way, we're talking about movement in supportive spaces and supportive environments. So I'm always going to be an avid an advocate for movement and safe spaces and athletics, combined with mental health services, because we don't want you just
mental health first aid and having an understanding of developing, expanding the knowledge and expanding the vocabulary to articulate that some of our patients, these aren't bad people, but they're experiencing specific things, and there's a name to that. Now there's a different kind of power. So having coaches in these spaces of movement who have an understanding of mental health issues or mental health concerns and challenges is a real major gateway to catapulting large-scale preventative measures within our communities.
To that question, just want to add onto that as well. Pastor Monrose and I actually teach a seminary class together this semester. And in the class, we had a particular class where we invited the director for the mayor's office of mental health to come into the class to speak to the seminarians in regards to what does this look like? How do we normalize this in our conversation? I know in many other faith traditions, it's welcomed. In my faith tradition and other faith traditions like mine, sometimes there's some hesitancy and some skepticism. And so creating those spaces, even from an educational space, to see how this can be a conversation among those who are faith leaders, and then can be communicated honestly and openly to the congregation and to those who are serving as well. So another hand up here. We have 2 more questions, and we're gonna have to. Is that ready for everybody?
Coming from a perspective of a new person in this type of work, meaning that I was that engineer, coming from an engineer, MS and industrial engineering background in transportation, and just sort of like getting thrown into the work. Our mindset as engineers is so systematic, floor plans, layouts, and timeline, but none of that is working in what I'm finding out. I am very active in my community. My ministry is called War Cry for My Children, and I'm that person that's actually getting information from the actual people in the community. And one of the alarming facts that I've worked up stats on is that a lot of our young people, when they're being incarcerated, there's some type of mental illness that's occurring in there. And then when they're returned back to the streets, they can't deal with life. And so one of the things I wanted to know is that, is there any way that they could be tested for mental illness and worked with in mental illness? Because as you know, just like with people on drugs, they know how to pretend and fake like nothing is happening when there's a lot of things happening. And in the Black household, we are always told what happens in here does what? Stays in here. So if we got a crazy uncle or somebody doing, we keep it in there. So there's a lot of distrust that between the police and the health practitioners that we have. So we've got to have people that are on the ground. I mean, I know it's good, but we need to get the money to the urban areas, train the people on the ground so we can turn this whole thing around. How can we do that?
Thank you for your comment. And quick question, where are you located? In Queens? Okay. There's some people in Queens that may be of assistance. I work for the New York City Health and Hospitals Corporation. Kings County Hospital is one of those major institutions. Queens Hospital Center out in Jamaica is another one. Jamaica Hospital isn't a part of that, but these are all places that have high amounts of trauma and do have behavioral health services. So Queens Hospital Center does have access to behavioral health services. Elmhurst Hospital is the larger, as well as probably one of the largest public hospital in Queens. They also have major comprehensive mental health services. That's over in East Elmhurst, right by, not too far from Roosevelt and Jackson Heights. So that may be a conduit to bring somebody in there if they need to be tested in a way, if they're not able to get access to some of the other programs. I'm sure our good doctor is going to mention, Dr. Jeff, this is Jeff, right? Dr. Jeff is going to mention, I'm sure, because I see he's looking at me. There's one thing that I don't want you to give up on. I don't want you to give up on your background and the things that you've come from. Healthcare itself, we look at it as a medical problem sometimes, but it's really a systems problem. And the systems problem is looking at how do we deliver these things into different components at different points in time. Many physicians don't think like that at all. Many nurses don't think like that. Our ER techs, and so it's the engineers who help orchestrate and figure out how do we improve the quality and flow to make sure it gets to the people who are most vulnerable. So don't lose that at all. Now, the problem that many of us have from community-based organizations are the resources that allow us to fix the systems. And so I think that's something that I think maybe we as a collective group in here may be able to help you with. Our organization, CAVI, does do trainings for people who are doing violence prevention and intervention. There's a mental health first aid. There's a whole cadre of people within the cure violence space that are also helping do trainings. There's an organization called the HAVI, HAVI.org, and HAVI is the Healing Alliance for Violence Intervention. They're formerly known as the National Network for Hospital-Based Violence Intervention Programs. But H is in Harry, A is in Apple, V is in Victor, and I is in Igloo.org. They are a major resource for people who are doing this stuff, who have been doing it for a while, and people who are starting out. There's specific protocols that they've been developing that all of our respective intervention programs are starting to use nationwide, because that, from a policy point of view, you can collect the same data sets, which help drive change. We can use our regular collective narratives and even use qualitative analysis, but we want to make sure that we can quantitate those studies and these data sets. They can push policies and agendas and even augment larger amounts of funding so that we can continue to do this work more purposefully. And once we finish doing this work, we can move on to the next places that are highly vulnerable.
I don't know if this is fair enough, but for those in this room who do advocacy and meet with electeds, I don't know if each of you in one word could tell us what you view, apart from changing laws, regulations, closing loopholes, pipeline, etc., in terms of funding streams. Is there one single area that you can recognize that can help? The number one priority, help change. Reduce gun violence in each of them. And I know it's multiples and it goes across the board. Everybody can say mental illness, but I know Jeff mentioned police departments. Is there one issue you could mention? That's the number one priority? Thank you.
New York has, so in many states, police officers are either licensed or certified by their state. And if they lose that certification, they can't work. So even if they have a poorly run police department, that doesn't terminate them. They'll lose their ability to work. So New York actually has very lax laws about its certification process. If you are an entry-level staff member for my organization to make $18, $19, $20, $21 an hour, you have to get fingerprinted and filed and all this stuff with something called the Justice Center. If you ever commit a neglectful or abusive act against someone with intellectual and developmental delay, you're banned from the field the rest of your life. That's not true for police officers. You can go from department to department because the state certification process in New York is pretty lax or pretty lacking. So I would do something that wouldn't cost any money, which is up the accountability of police officers by taking away their certification if they misbehave, and they'll behave better. Trying to do this department by department isn't going to work.
Well, I have two. One, the debt limit discussion is pretty crazy. Going back to fiscal year 2022 would impact all of the things that we're talking about here that impact the social determinants of health and violence. But if there was one like funding stream, I would say community violence intervention. Like, it has gotten a lot of interest and there is bipartisan support, a lot because of like the data sets and the research that's been done about the effectiveness of that community work. So at the federal level, there has been pretty large appropriations that also exist at the state and local levels as well.
I'll cheat a little. Not because I'm a lawyer, but that's how it works. I would say, again, you need a whole of government response, right? You need coordination as the theme of the day, right? You need the left hand to know what the right hand is doing. So I would, when I think states like New York that have set up an office of gun violence prevention, that can become like the hub of the wheel, right? That has real entry points to law enforcement, to state government, to the governor's offices, to these community groups, can then turn around and give that funding out as direct grants, can then give out support in the form of TA, technical assistance, or other kinds of resourcing. Because again, these organizations are not huge by and large. They're not always badly insufficient resource. They don't have the infrastructure often to continue the life-saving work well and robustly in places where they are doing it now. So I think if there's a way to channel into, I think you get the ancillary benefit of statewide coordination, right? The state laws matter, local laws matter, law enforcement upstate, downstate, elsewhere has to be aligned. You have to have clear processes and clear understanding of what the law is and how it's being enforced. And I think if you can put resources into that kind of whole of government response, that's your best bet.
Two things. One, start, so people have an interest in their thinking and going over these ideas in their head. Just to start, do the work. Start with a small cohort and grow from that. You constantly. I was in my head with the organization and the work we're doing for at least 6 years because we're getting pushback and didn't have funding. It wasn't until we started doing the work that we started making a difference, and then eventually funding came a few years later. So you just have to start and be willing to fail and go back to the drawing board. And the second is for people who are funders, you have to fund both the small grassroots as well as the larger scale organizations. The work that we do in our respective hospitals would not be possible. You have the larger institution as the hospital entity, but if it weren't for the small community-based organizations and the small grassroots who have an intimate knowledge of the people in the community, this stuff wasn't making a major dent, which is why groups like the 67th Clergy Council have been a major force because they had access to people that the hospitals weren't connecting to, which is why people, Eric and Monique, I've known Eric Waterman and Monique Waterman for a long time because I remember when everybody was starting off and nobody was paying us any attention. And we were like yelling, yo, come help us. We know these kids, we know where they live, they knock on our doors, they ring our doorbells, we need some funding. And people are like, yo, great idea. Sorry, there's no money. And so you wind up working inefficiently because you don't have the financial capacity to do that. So when, as a funder, pay attention to the larger organizations and pay attention to the small grassroots organizations that have a lot of promise, because those are definitely gems that are there. They're going to be highly effective.
Thank you for that. And also, you also bring up to me, I wanted to give a shout out in regards to faith, knowing those who are doing this work, connecting with them and partnering strategically. That's how I first met our now Assembly member Monique Chandler Waterman, who's here with us today. He's also a member of our congregation in regards to just doing that work in our time has come to an end, but can we put our hands together for this investment? Thank you once again, and turn it over to.
So one more round of applause. I just wanted to mention when we started this journey, and Emily and Robert Predator, it was sort of like, what do we get? What do we get? Wow. Just wow. No, we don't. Not only did we get it, we're getting. We're getting to where we need to be. So one of the next steps, of course, is lunch. That's important. Is to on your journey, you gotta sustain stuff, right? You gotta have a little energy. You gotta have a little fuel from the journey. So we're gonna ask you to step out. If there's box lunches, come back in. Talk amongst one another. Wait. Let's talk about clergy people. I want to. That's one. So one can go and we'll send you out there and get lunch, bring it back in, talk amongst one another. We're going to cut it down a little bit because we started a little bit late. We're going to hear from the assembly person during lunch, and the assembly person helped us to found, before she became the assembly person with the mayor, she helped us to found the Brooklyn Coalition on Healthcare Disparities. talk about being holistic, about how you approach these things, it's being holistic. And I want you to talk amongst each other. I'm going to leave you a question. I'm going to leave you a question to talk about. You'll find it to talk about taking work. We'll talk about sandwiches, talking about something. My question is how do we get out of a space where people think guns are a problem-solving device? That's what I want you to. How do we get out of the space where we think that a problem-solving device is a gun? We got to find other problem-solving devices. So enjoy lunch. We'll see you all in a little bit. I'll be right back.
Again, sorry to interrupt your lunch. I hope you're all enjoying the food. I just wanted to introduce a couple of people who will just speak for a brief moment before our next panel. First, the CEO of JCRC, Gideon Taylor, who's right here joining us today. And then we will hear from Assemblymember Monique Chandler-Waterman, who you heard mentioned several times already because she's doing really incredible work in this field. You also heard briefly from her husband, Eric, who's over there.
Great. So, look, what an honor to stand in front of such a group. At JCRC, we are so privileged to be here with our partners, UJA, with partners from the Jewish community, from the wider New York community. I want to just express the appreciation we all feel to those who have put this together. Karen Kastner, who dreamed a dream, Bob Kaplan, Emily Bogdan, and the entire team at the Shared Society group of department of center of JCRC. We're joined here by the president of JCRC, Ben Golub. I'm glad that Ben is here, and many staff as well. You know, I, like Michael Dowling, am an immigrant from the same country as Michael, as you may tell from my accent. I grew up in Ireland, and guns were not part of the society I grew up in. Growing up as a child, I never saw a gun. There was issues of wider terrorism, etc., far away, but the idea of guns on the streets was something that was completely alien to me. And as I've moved here, have children here, brought up children here, it is an issue which clearly resonates, and as we hear from our speakers, who frame the issues in ways both factual, detailed, emotional, personal, one of the defining issues for what happens in this city and in this country. So I thank you. I am honored to be with you, and we at JCRC, we're inspired by all what you do and what you strive to do, and we look forward to working with you, being partners with you in the journey ahead. Thank you.
Assemblymember Chandler-Waterman, would you like to give a few words? Thank you.
Good afternoon, everyone. All right, good afternoon, everyone. I know I didn't get sleep because we just had to pass a budget last night, but we did it. We got here, right? So I want to thank JCRC for being such a trusted partner, for all the support way beyond I was elected in the community. Thank you to Rabbi Kaplan. Thank you to Gideon. I saw him, my partners, for Israel, right, that took care of me as we did our trip recently. Noam, Rabbi Miller. Thank y'all all so much for the support for the electeds in the community, and just being a trusted partner and constantly supporting us in this effort, especially as we talk about gun violence and mental health. And thank you to all the amazing panelists. Let's give it up to the whole team here. and everyone who organizes, because there's always people in the front, but there's a lot of people behind the scenes, right? Emily and others who supported this, right? So one of the biggest things when you come up here, you don't want to forget to thank anybody. But just if, please, my pastor, Galbraith, will say, charge it to my mind and not to my heart, all right? So I just want to just state, I am from Brooklyn. I'm Assembly Member Monique Chandler Waterman, as you heard, newly elected, first Black woman, Caribbean woman to hold a seat in Brooklyn, replacing our U.S. Ambassador to Jamaica, Nick Perry. He's been appointed in that position. He's now in Jamaica. So that covers East Flatbush mainly, but it's parts of Canarsie, a little bit of Brownsville, a little bit of Crown Heights. So for over, I would say, 20 years, I've been advocating to reduce gun violence and to destigmatize and decriminalize mental health. How does that translate as an advocate and now being a legislator? So I'm going to take it back a little bit. I have 4 amazing children. I have a 21-year-old, a 20, 17, and now 15-year-old. And you may have met my husband of 22 years, Eric Waterman, right over there. And when I had my first child, everything looks different. The world looked different to me. The garbage issues were like the streets didn't look clean. There was so much things happening in the community. And I said, what have I done? And it was 9/11 when I had my child. So I was like, where did I bring my child into this world? So I was like, you know what? We have a responsibility when we bring kids into this world to make sure we make it better. So I could focus on my household, or holistically, do I take care of the whole community? Because my kids still have to leave the house, right, to go outside. So I said, I don't have to move to another community to make it better. I'm going to stay right here in my community and make sure that it's better. So in that effort, we started a 24-hour child care facility because I didn't like the quality of child care. And I was working midnight shifts. My husband and I work Sunday to Tuesday. He'll work Wednesday to Saturday. We barely saw each other. We worked 7 p.m. to 7 a.m. They had to be more people like us, right? And we wanted arts and we wanted music. We wanted different things for the kids. We wanted to make sure they had all of that and be able to read by the time they got to pre-K in the public school. So we started there. Then we realized with the domestic violence situation, there's different things going on, gun violence, that we need to start a nonprofit because idle hands is the devil workshop. So we started East Flatbush Village, Inc. at the time. And it was just providing wraparound services. My mom worked 3 to 4 jobs. My grandparents had to take care of me. My father was not in the home. My mother with public assistance, had to support us, the pantries, our clergy. It took a whole village to make sure I am here today. So I wanted to pour back into that village. It started with having a child, like, wow, we need to do something about it. And then, how did I get here? My teacher took me to church, right? My pastor bought me clothes the first day of school. So then how do we embody that concept? And then that's how the organization got formed. And as a legislator, as an advocate and now legislator, I'm like, God put me through all these things, hardships, trials, tests, to now testimonies. How do I now bring that over to legislative capacity? Through policy, through funding. So we started, when I got into office in May, it's not a year yet, what I did is create a task force. I needed people with lived experience from the community, from my district. We have a mental health task force. That's someone who's been living with mental health challenges, those who's been impacted with trauma. They're on the task force. We have public safety task force. Kings Against Violence Initiative, CAVI, they're part of that. God Squad is a part of that. East Flatbush Village, Inc. is a part of that. We have CCRB. We have those who were impacted by gun violence, those who were part of gangs or trying to get out of gangs, whatever. We have all of that together because I know one perspective, but you need to have the ear of the ground. My job is to represent the entire district, not just to go up. When I go to upstate, when I go to Albany, I have to still have Brooklyn and my district in mind. So that is what leads the priorities of our office. So we work with task force from mental health to public safety to education. I have a faith leaders task force, and I also have small business and nonprofits and quality of life. And what I do is when I'm thinking about legislation, we're thinking about funding, we go to those task forces and say, hey, here's some legislation we're thinking about. Rabbi was at the mass shooting press conference we had, where 4 or more we're saying through legislation, that's considered a mass shooting. Unfortunately, in a more affluent neighborhood, automatically it's called a mass shooting. In the black and brown community, it's called multiple, it's called triple, it's massive. When anybody gets shot, we don't want anybody to get shot. But what I learned is mass shootings, when it's labeled that, it comes with resources. So we want to make sure, no matter what color, what background you are, that if 4 more got shot, we get the same resources in any community. So that's part of what my mission and vision is to make sure not only am I representing 130,000+ people, am I really bringing the voices from the district when I get to Albany? Yes, we're helping New York State as a whole, but how do we make sure holistically we are not only just representing the state, we are also representing those 130,000 people that elect me to be in office? It is people over politics. It's people over the power. I'm here, and I always say, sorry to get a little religious, right, on you, is this seat right here that I'm in is God's seat. That's how I see it. And I'm here in the physical form to do the work that I need to do. So it's not about me. I'm a child of God. And it's more about that I have a responsibility to the people in the community. So we just passed a budget, a big budget, $229 billion budget, and it was late. But it was important for it to be a right budget and not just an untimed budget. And I can't tell you one thing in Brooklyn and then go to Albany and then say something different. So we had some of the things that we were going back and forth with the governor was on bail reform. There's a lot of hype and a lot of fear-mongering when it comes to certain words, when it comes to public safety. Crime did not go up because of bail reform. So we had to make sure that message got out. And that was some of the things that was we had to fight to make sure we didn't get a holistic overhaul of bail reform. So those are some of the things in housing. Some of those things was at the table. It's very complex, but I do my best on a monthly basis to explain through my Vital Voice meeting, what do I do as an elected official? How do you call me accountable? And it's important that we know that civic engagement. We had a redistricting process that I heard someone mention. Every 10 years, there's a census, there's more people, less people. We had to figure that all out. All of Canarsie was cut off our district. Jefferson Gorman, Brownsville was cut off our district. We made sure the community members understood what that meant. When you build common interest and you build all the civic engagement, and when you campaign, people, it's like, I don't trust elected officials, and you convince them to trust in the system again and to vote and do all that, and then you do all these wonderful things and all these resources, and then now they say, sorry, new elected, start the process again. That people lose hope. So I'm proud to say today, because of all the civic engagement, the meetings we had, they came to hear us, over 70 people in the district. We have 99.7% of the district back. We wanted 100%, but we got that. So the power is in the people, and if you don't know how to advocate, then you don't know what to do when it comes to reducing gun violence. And I will close, because I know I have limited time. With the Public Safety Task Force, what we do is that same engagement. We have something called our 4 pillars. It's prevention, intervention, restoration, and legislation. So those same former gang members or those who's active trying to get out, they are making legislation. They realize the power is in them organizing, choosing the right person that has their interest in mind, and then what do you do to bring resources to their district? I'm proud to say that a lot of them are leading those same meetings we have at the Vital Voice. A lot of them is out there making sure right people get in office. A lot of them is out there advocating. So to me, telling somebody to put down the gun is not enough, because they need to have resources. So they need housing, affordable housing. They need wraparound services. They need the food. They need proper education. The trigger is pulled before the trigger is pulled. We can't wait till the trigger is pulled on the streets, but then we have oppressed them in so many ways. When your back is against the wall, think about it from a mama or a papa perspective, and you don't got a place for your child to live. You don't have food. You don't have that. You're going to do it by any means necessary. So we cannot, in government or anybody, we cannot say we're not part of the problem. The trigger is pulled when that 1-year-old mom has to work 4 jobs because she can't afford that rent. That's when the trigger is pulled. We see it 18 years later and figure out what happened. We contributed to that. So how can I do my part and we do our part? This is not an I thing. This is a we thing, and we got to all do this together. So when you talk about mental health and the trauma, we have to destigmatize and decriminalize by having constant conversation. 988 is a number that we advocated for way before I was elected, and that with a public advocate, Jamani Williams, at the time, where you could call a number with a non-police response and get a mental health professional. We got to talk about this as people get overwhelmed to our kids and beyond. We got to continue talking about mental health as an everyday topic, and that is how you destigmatize and make it more comfortable in spaces, because we're all one or two situations, God forbid, away from a mental health breakdown. And if left untreated, it becomes a condition. And we live in trauma every day, unfortunately, and the trauma, the mental health, the public safety, gun violence, all that go hand in hand. But we need resource. We need to over-resource an area, and that's how we reduce these issues we have in our community. So thank you all for your part that you play in this. But thank you for your time. And I probably went over. I'm sorry, Rabbi, but I really appreciate it. Thank you.
Call fire, folks. I hope you all enjoyed your lunch. There are a few extra lunches left, and if you can see Rachel Lissy, Rachel is over there in the corner. Afterwards, if you have a group you can bring them back to, or other people want to bring them back to other places, please feel free to see Rachel and take them with you. We never like to see food discarded. We like to see it winding up in people's bellies, because we're living in a very precarious world. We're going to go into our next panel on our journey. Then after that, we're going to break down into small groups. There's a number of small groups that should be on your agenda. Again, use the QR codes. One of the small groups is going to be what the next steps look like. So those who want to help plan out those next steps, please feel free to be part of that. And the next panel is going to be looking at gun violence and public safety, because everyone talked about the need for us all to be safe, and it's everyone deserves, that's the title, everyone deserves to be safe. So the folks that I'm going to ask to come up and be part of the panel, the person that's going to be moderating the panel is Rabbi Hilly Haber. Rabbi Haber is from Central Synagogue. I'm only going to talk about the moderator right now. Again, look up the rest of the bios. Rabbi Haber is from Central Synagogue and is also the co-chair of the New York Jewish Coalition on Criminal Justice Reform. Most of all, a dear, dear friend and teacher. We're going to ask Kellen Khalifu to come up for the Center for Justice Innovation, a violence interrupter, Neighbors in Action. We're going to ask for Tatiana Amlin to come up from the New York DA's office. We're going to ask for Dr. Sanjali Rajan from Columbia Surge, Drew Skinner from the DOJ, Department of Justice, and Akila Sherels from the Community-Based Public Safety Collective. Again, look up all their various bios online, but I would just listen to what they have to tell you, because who they really are, I'm sure will come up very powerfully during this next panel. Thank you.
Hey, good afternoon, everyone. Hey, thank you. Hi. Thank you so much for being here. And I'm so grateful to our panelists. Thank you all so much for being here. I think we're waiting for one more person. Maybe we'll get started. So I'm just going to ask each of you to introduce yourselves, just a word of introduction, but also to share from your perspective, from your work, kind of from where your personal experience and from where you sit professionally. If you could just help us define gun violence what does it look like? I know we've been talking a lot about it today, but I think each of you has a unique perspective. Help us build kind of a collective definition for gun violence that we can use throughout this conversation. So, want to get started?
Sure. Hi, everyone. I'm Tatiana Amlin. I am with the Manhattan District Attorney's Office, where I work in the Pathways to Public Safety Division. I started my career as a trial division assistant, prosecuting gun violence, gang violence, narcotics, domestic violence throughout the city. And about halfway through my career, I learned about a lot of the things you heard in the earlier panel, particularly adverse childhood experiences, and that was a real light bulb moment for me in my career, and I pivoted into working in alternatives to incarceration. And what we do there is we look for programming-based dispositions to work with young people and older people to hopefully stop the cycle and the reasons that they are committing crimes. And in particular, around gun violence, what I really see in interviewing a lot of these young men and women and victims of violence throughout the city is a crisis of belonging and a real need to show people that they are a part of our community, to connect them with organizations where they can feel like someone important and that they have a future that is not just hanging around not so social, pro-social places and people that may lead to criminal justice involvement.
Hi, good afternoon. It's not morning. I was just chaperoning a field trip this morning, so I'm still in mom mode. So I'm Sonali Rajan. I'm an associate professor in the Department of Health and Behavior Studies at Teachers College at Columbia University. I also have an appointment in the Department of Epidemiology at Columbia's Mailman School of Public Health. And I'm currently the president of the newly launched Research Society for the Prevention of Firearm-Related Harms. And I share that mostly to say that I think about gun violence very much from the perspective of what is the science telling us about what evidence-based and effective solutions can and should look like. My primary areas of research really are focused on, of course, gun violence, but more specifically, school safety, adverse childhood experiences, as you were just saying, and really the impact of gun violence on children, both direct and indirect forms of gun violence. And that really shapes how I think about this issue, which is that while it's important that we are quantifying the number of people who are shot and killed every year with firearms, of course, that is a big part of the gun violence epidemic in this country. It's also important that we are understanding and then preventing and also responding to in the aftermath the other types of exposure that kids are, in particular in their communities, are experiencing both in schools and out of school. I'll stop. I could talk forever, so I'll stop. But that's generally where my work sits, and I'm just so happy to be here today, so thank you.
Good afternoon, everyone. My name is Drew Skinner. I'm a federal prosecutor in the United States Attorney's Office in the Southern District of New York. We cover Manhattan, the Bronx, Westchester, and other counties north of there. I'm the co-chief of the Violent and Organized Crime Unit in our office, and so that means that I have supervised about 20 federal prosecutors, and we investigate and prosecute murders, gang cases, firearms cases, sex trafficking cases are in my unit. You asked what's gun violence. It's certainly not all of it, what I'm about to say. I'll just give you the piece that I see most in my day-to-day work. The gun violence that we see the most in our office is retaliatory gang violence. It's crews of increasingly these days younger and younger, usually men, who are doing shootings over perceived slights in the neighborhood. Sometimes it's related to drug trafficking. Too often it's related to something that might seem silly to the rest of us or in hindsight, but people think that the right way to solve those problems is through shootings, and then it escalates from there, and those shootings can go on for months and months and years. And no question, it has a disproportionate impact in underserved neighborhoods. That's the places where I'm seeing this violence the most, where both the victims and the people doing the shootings are.
All right. Good afternoon, everybody. I'm the board chair of the Newark Community Street Team and the executive director of the Community-Based Public Safety Collective. The Newark Community Street Team, NCST, is one of the nation's premier community-based public safety initiatives or community violence prevention initiatives out of Newark, New Jersey, launched about in 2014 by our visionary leader in the city, Mayor Ras Baraka. We've now had 7 consecutive years in a row of decreases of homicide and overall violence. Newark, for many of you know, was on the top 10 most violent city list for almost 50 consecutive years. And we have figured something out. And, with a lot of prayer and a lot of support, we've been able to move the needle pretty far down the field and support our community-based public safety, our community violence intervention agency. The collective, the Community-Based Public Safety Collective, it's our national TTA provider, training and technical assistance provider. We've exported our strategy to multiple cities across the country so that CBI literally serves as a complementary strategy to policing in cities. I come from this work as a practitioner and as a former gang member. I grew up in the culture. I'm originally from Los Angeles. In 1992, myself and my brother and a group of friends organized a peace treaty between the Crips and Bloods in our neighborhood that changed the quality of life in our community. I co-founded a dozen nonprofits, but I would say one of the most significant ones in the 90s was Jim Brown's American Can program. Before the advent of social media, we were in 15 cities across the country working on issues of gang violence, of community violence. And today, I feel like, after 30 years of doing this work on the front line and in the trenches, I'm a survivor as well. My oldest son was murdered 20 years ago, home from winter break. So this work is it's personal and professional for me, and excited to be here with all of you today.
Greetings, everyone. How are we doing today? Great. My name is Kellen Kalefu. I'm a social worker. Specifically, I'm director of Neighbors in Action, which is a demonstration project of the Center for Justice Innovation. Really quickly, the Center for Justice Innovation, many of you might have known us as a former name, the Center for Court Innovation, is a justice reform public safety agency that looks to create a more humane and effective justice system through research, demonstration projects like Neighbors in Action, or NEA for short, and technical and expert assistance, where we share our best practices, toolkits, domestically and internationally with different communities and jurisdictions who are looking to find creative and innovative solutions. Specifically at NEA, what we do, centralized in Crown Heights and Bed-Stuy, Brooklyn, we really look to combat a lot of the ills of our community through development and not the reduction of the illness. There's a huge distinction between that I'm sure we'll be able to unpack a little bit later. But specifically what we do, young people are often at times the most vulnerable with all of these ills that society has, yet have voice and are often not invited into spaces where decisions are made. So at NEA, we invite our youth through development programs that helps them to build, but more importantly, put them in the space that they need as community leaders. Secondly, we do community violence, right, which is a lot about cure violence, crisis management work. Then we do a lot of things around healing and well-being, right? Talk about gun violence, right? Before, during, and after gun violence. How we deal with trauma is going to be retaliation happens, but more importantly, growth, because trauma stunts growth in many aspects. Lastly is about capacity building. As we do this work, we want to make sure that communities aren't dependent on us, that we are also providing the skills, the platforms, and amplifying the voices. That was a lot. To the question about how do we define gun violence, specifically with our crisis management program, Save Our Streets Brooklyn, which I want to shout out some of our alumni that we have here who helped founded that program back in 2010, New York City's first replication of the Cure Violence program. We look at it from a public health lens. So I look at gun violence as not the issue, but the symptom of a larger issue, which oftentimes goes into poverty, marginalization, racism, social and emotional lack of investment, and also.
Thanks, Kellen. Thank you, everyone. This is such an incredible panel, so I just want to say really thank you for your time, and I'm so excited to hear from each of you really based on your expertise and lived experience. The next question is really about the root causes of gun violence, and I think if we misidentify the root cause, we're going to come up with the wrong solutions. So from where you sit, and Kellen, you already started, so maybe you'll start us off because you're really getting into this. What, from your experience, what are the root causes of gun violence?
Many. So I do want to list a few that are a little bit closer to us in terms of things that we're trying to address. So poverty is a major aspect, right? When we look at gun violence, there are many reasons why people engage with guns, both for positive, not so positive reasons on our reasoning, but there's economic factors that in communities, specifically Black and brown communities, access to the main economic engines of this society are often cut. There's barriers, or there's so many hurdles to get over that you have to make a way out of no way. So poverty is a major aspect. With poverty also comes lack of ownership, and there's a distance that people experience when they live in communities where many times they're the ones who are stewarding the space, but when it comes to decision makings, they're usually not the people who decides whether a bike lane comes to a place, whether what type of parks happens, how funding for schools happen, a lot of laws against people congregating, right, in public spaces. Those things help to send a message to say that you're not valued here. And in many ways, people react to that in many different fashions. Other spaces are people all seek an identity, right? And what we have available to us are pathways for us to carve out our identity, to see what we're skilled at, to see how we can contribute, to figure out ways how we can build ourselves up. Sometimes when guns are really available and there's a culture, right, of gun violence or whatever it may be, those things happen. I think last but not least, this country definitely has a gun culture that's unique to any other country in this planet, on this world. And I think part of that is being able to unpack that a little bit and figure out, like, how can we promote more opportunities for people to develop in the pathways that we want, and less emphasis on just reducing crime. Because there's one thing to, you can have no shootings in the city and people could still not be at peace, right? But when you invest in peace, right, what does that mean? That people have adequate jobs that they can live. That means people have outlets recreationally, professionally, health-wise, that they can live, learn, and grow. Communities that do that tend to be the safest communities. And those safe communities, whether there's strict gun laws or not, right? Because I do want to mention that safe communities are usually interconnected communities where people know each other, spaces where people have opportunities to build relationships and bonds with each other. And those are the things that help people to have outlets to mediate their conflicts before it has to go to law enforcement or any other entity. Also, it creates a opportunity for people to support each other. And when that happens, when people get a sense of, like, fulfillment from creating a sense of peace and building someone up, what that does transforms not only a person, but a community.
Yeah. Maybe we'll come down the line, Akila, and anything you want to add on the root causes?
Yeah, I would just add that as the brother said, that safety is not just the absence of violence and crime. It's also the presence of well-being and the infrastructure to support victims and survivors in their respective healing journey. And so, as we know, that poverty is one of the things that underscores gun violence. Trauma, is one of the things that perpetuates it, right? And, in our community, whether it's, vicarious trauma, hypervigilance, traumatic stress, these things have gone unaddressed, in a one-sided criminal legal system, that we, operated for 100 years, right? Our criminal legal system, when someone is harmed in community, we deploy law enforcement to apprehend the perpetrator, but we didn't deploy therapists and healers and counselors to address, the high levels of traumatic stress and hypervigilance, that underscored the violence that happens in the neighborhood, right? And one of the things that my brother said is that also racism plays a huge role, in who gets treated in terms of, services for gun violence, right? And so why do, like we're in Newark, we're doing a study and we're just wrapping it down on illicit gun ownership, where we were asking folks, like, why do you own guns in the neighborhood? And someone said it on the last panel, that clearance rates, for most police departments, for homicides are, at 18, 19%. And then for non-fatals, it's in the single digits. So who trusts the police department? You know what I'm saying? To address like kind of, horrific situations when they come up in a neighborhood. No one. So, and especially if you're black, you get harmed, you go to the police department and say, hey, look, this has happened to me. They'll ask you where your gun at, and how are you defending yourself and your family? Like straight up, okay? This is racism, implicit bias, systemic racism that has permeated our criminal legal system forever, and so therefore we've allowed like trauma, to fester and to ripple, in certain communities without the type of support, that's needed in order to address it. The last thing that I would say about gun violence is that as the brother said, it's a disease, and we understand that violence is a public health issue, right? And gun violence is a public health issue. The thing is that we're still not doing enough in terms of investing in Pookie, Raheem, and Sabrina and them, the folks who are on the front line, because the public health frame says that those who are closest in proximity to the violence have to be equipped with the skills, the tools, and the resources to do the intervention, the prevention, and the treatment. We still haven't figured out that we have to invest in Pookie, Raheem, and Sabrina now. We still haven't figured out that we have to invest in new workforce development systems because the corporate model doesn't work, for folks who have been disenfranchised and disconnected, from mainstream, right? So we have to like think at a very complex level, about the ecosystem that we create. But just in terms of focusing, right? If at the center of our ecosystem, if we're not empowering those who are closest in proximity to the violence, Pookie, Raheem, and Sabrina and them, with the skills, the tools, and the resources to do the intervention, the prevention, and the treatment, then a lot of the policies that we make, a lot of the legislation, because you can't legislate peace in the neighborhood. You know what I'm saying? You can pass a law, but the victory is not until that law becomes, a program and becomes an RFP, then is put out, and then our community organizations apply for it and get the money and then start providing the services directly. The policy is not the only win. The policy change is not the big win. The big win is when our organizations on the ground in neighborhoods get the resources to do the intervention, the prevention, and the treatment.
So first of all, I don't pretend to be an expert on root causes. I'll tell you what I see from my perspective, the cases that come across my desk. I 100% agree with Kellen. Yeah, 100% agree with what he said about poverty and identity. Those are things that I see in almost every case that we get. It's people in neighborhoods that don't have resources and don't have probably an optimistic view on life and are trying to make money, often through drugs. And if you're selling drugs and you have a competitor that's giving you a problem, or somebody stole your drugs, or somebody didn't pay you back, you can't go to the police and say, hey, I'm selling drugs and somebody stole my drugs. Unfortunately, that leads to people trying to solve problems themselves. And they know that their competitor has a gun and they have a gun, and that's the way that too many of these problems are solved in under-resourced neighborhoods. Identity, I think, is also part of it. Almost every New York City housing development has a crew that lives in it. Some of the people that live there identify as a certain gang or crew from that area. It's not just housing developments, it's other neighborhoods too. And they have years-long disputes with other housing developments or other neighborhoods, and those continue for too long. I think often the people that are part of it don't really know why they have a beef with the other housing project, but they know they do. And if they see one of those guys, there's going to be a problem, and they better have their gun because those guys are going to have a gun. So that's another cause of it. I do just want to talk about the clearance rate thing. From my perspective on the prosecutor side, solving murders and shootings are really hard. People don't want to be caught. They don't want to leave that evidence behind. And unfortunately, one reason that it's really hard is because a lot of people don't want to come forward to the police and law enforcement and say what they saw. And And that's on police and law enforcement. Like, we have to build trust in the community so that people are willing to talk to us about what they see and feel protected, and feel like we'll listen to them. That's hugely important community engagement and trust building, in part so that we can protect the public and build good, successful cases.
So I'm going to echo my colleagues here, and I'll just say that everything you've heard about the root causes of gun violence in our community also plays out in our schools. And so to adapt from what you were saying, Kellen, I say this all the time, which is that schools, it's not enough for schools to just be places that are free from violence. Schools also need to be places where children can thrive. And that needs to apply not just to the most privileged kids and the most well-resourced schools, but for all children. And so right now, our public school system in the U.S. serves 51 million children. And so this sort of tenet should be something that all those children experience, and they unfortunately don't. I think one of the challenges, the poverty, the racism, the redlining, all of that plays out in our public school districts, right? So we see that happening. Some work that my colleagues and I'm just going to share this, some work that my colleagues and I did last year. It was a pretty straightforward paper we wrote, and we were working on this analysis. We were looking at kids ages 5 to 17, and we were trying to quantify exposure to gun violence in their neighborhood. So we were looking at the numbers and trying to figure out, okay, what is the prevalence of exposure to gun violence over the past few years? How has this changed since COVID? Essentially trying to understand if you're a kid living in any given neighborhood, we looked at this by census tract, what was the likelihood that you were exposed to at least one firearm fatality in your neighborhood? So we're doing this analysis. So first of all, it's like millions of kids, millions. Like, the number is so staggering when you think about the sheer number of just kids exposed to this kind of violence. Then we stratified by race, which is lots of issues with using race as a variable and all those kinds of things, but importantly, just to try to understand what are the experiences of Black children, how does that compare to the experiences of white children and other subgroups. So we have this wonderful colleague, and she's doing this analysis, and she sends us these results, and we're like, this can't be right, because what it showed in that paper, in this work, is that Black children in this country are 4.5 times more likely to experience that kind of violence in their neighborhoods compared to their white peers. 4.5. When I made this poor woman rerun that data multiple times, I'm not trying to make light of it, but I think that discrepancy took my breath away. So not only do we see children experiencing gun violence at these very high rates, we also see these very, very clear racial disparities. That number, by the way, has only gotten worse since the onset of COVID, and that, I think, speaks to the root causes here, right? The fact that we need to disrupt cycles of disenfranchisement. We need to invest in our schools. We cannot have punitive disciplinary policies that just result in kids being expelled and removed from the school system, because that's the easy short-term solution, right? To remove the, quote, problem child. Children aren't problems. That's not what happens. Children are being placed at high risk. And it is our job, it is our responsibility as the adults in the room, right, to collectively attend to that. So I will echo all of this, but I think, yeah, I'll echo all of this and just say that we have a lot of work to do.
Really hard to go last, because you're all saying, what I'm thinking, but it's a really exciting time to work in this world, because we are evolving, and law enforcement is evolving, and prosecutors are evolving. And I get to ask this question to every young man and woman I work with in our treatment courts: why were you carrying a gun? And almost every single time, it's the title of this panel: because I feel unsafe. And we really have to learn, as prosecutors and as members of this community, that people live under toxic stress in a place where this type of behavior is normalized. And they will tell me time and time again, Ms. Amlin, I know I was arrested. It's very scary to be in this situation, but I would rather have a gun on me if there is a scary, violent interaction than not have a gun on me. I would rather be arrested and go through this process. And when you talk to victims of gun violence, members of our community, we all know that when you send someone to state prison, you are creating more problems. They are losing access to their families, to their jobs, to their housing, to their communities, and they're going to come back to the same neighborhood. And a lot of people in these neighborhoods would rather these people come back to them whole right? We talked about this morning, whole, with an identity, with a goal, with people around them, than having lost those opportunities. And so there's a real push, especially in my offices and offices around the country, to work together with the people sitting on this stage to find holistic solutions to people charged with very scary crimes, and to look at cognitive behavioral therapy, trauma therapy, pro-social development, workforce development, getting them involved with other people. When you surround yourself with good people, it makes you want to do good things. And for us to be a little bit more understanding that it's not just good guys and bad guys, but that, you know, when you try cases, it's the elements of the crime. It's identity and, you know, what's under the penal law. In doing this kind of work, we're really trying to understand why someone is causing a crime. Can we manage them safely in the community? And are there programs out there to help them? And so we need more programs. We need more funding for these programs. And for a lot of the young people I work with, we need people who are willing to hire them in jobs despite their backgrounds, people who are willing to rent them apartments despite their backgrounds, and people willing to sit down and work with them and mentor them and make them feel valuable. Because a lot of these people get caught up in places where they feel like they belong, which are not necessarily pro-social. And we need to show them new options and that they matter. And I just want to share something that actually happened yesterday, and it was like very fortuitous before this panel. I was in our treatment court, and we had a graduation, and it was a young man who was charged with criminal possession of a weapon in the 2nd degree. He got pulled over in a car. He had a loaded gun in there, and he had just completed a year of programming with Bronx Connect. And this young man, I'd seen him in court many times. When he started, very withdrawn, the body language, you know, very pulled in. At his graduation, despite actually having broken his ankle and just having surgery, this man was beaming, absolutely beaming, and so proud to tell the judge about the work that he had done this year, the training that he had done to become a credible messenger, how transformative that was for him to not only better himself, get a job, work on the trauma and the inner issues that were going on that led him to carry a gun and feel unsafe, but now to be an example to the other people in his group and his community to show that you can make a change. And after that guy graduated in this wonderful speech, I had someone on who was struggling in his programming. And he said, I just saw that graduation, Ms. Amlin and Judge Byben. I want to be like that guy. And it's creating more role models who have lived the experience and can say, if I can do it, you can do it too. And people like us supporting them and working together in that journey.
Thank you. I want to keep going kind of with these examples with models that are working. What are successful models that you're seeing? So I have kind of specific questions for each of you, but Dr. Rajan, I'll start with you if that's okay.
Sure.
Kind of what are you seeing in schools? And I think too, not just addressing violence, but the trauma of violence, how you said the number of kids who are exposed to gun violence, even just hearing about gun violence. Where are you seeing successful models for addressing that kind of trauma and also the violence?
Okay. Well, this is a whole panel in and of itself, but I'll give you, I think, my short version of this. So I'll tell you that right now, and very understandably, schools are being put in a position where they're trying to do what they can to respond to the anticipation of this kind of gun violence. And how could you not, right? You see the news and Nashville and Uvalde and Parkland. I mean, this punctuates our day to day. It is far, far, far too prevalent. The challenge right now is that, and this is because we're not collectively addressing, right, the root causes in our community. So I think part of reducing school gun violence is reducing community level gun violence, reducing access to firearms, all of that. There's a whole framework for that my colleagues and I have put forward that draws on this collective body of work. But within schools, and very understandably, you know, we are seeing schools try to, they're investing in what we call reactive strategies. So we're arming teachers and we're investing in bulletproof backpacks. And my beautiful little 7-year-old has now gone through 6 active shooter drills in his lifetime, which just kills me because it's not doing doing shit, I can tell you that, to actually prevent anything. So it makes me, it behooves us to look at this and say, all right, we are hardening our schools and we are investing in these strategies, many of which are very, very expensive. I'll tell you that arming teachers, there was a report that came out in 2013 that said if we armed even one teacher in every public school in this country, it would eat up 30% of our federal education budget. We don't have enough money to ensure that our kids are not hungry, right? We're not we are not paying our teachers enough. We don't even, most schools don't even have like a full-time school nurse, and we're trying to so when we look at the current reaction, it's understandable, but it's also deeply misguided in the sense that there's no evidence driving these solutions. We don't know that they work. This is actually work that my colleagues and I are doing right now, is to actually evaluate the effectiveness of these strategies in a rigorous way. And there's also, I think, a sense that like these awful, horrific shootings happen. So the natural inclination is to want to implement an equally aggressive response, right? It makes total sense. No one really wants to hear we need more green space and housing and street lighting, even though all of those things work and are actually where the solutions should be. It doesn't sound like it's a reaction. And that same thing plays out in school. No one wants to hear that restorative justice practices work or that reducing punitive disciplinary policies work, but they do. So this is my long way of saying there aren't that many great models right now of schools that are implementing best practices, because there's very little actually informing what those best practices should look like. And many people in positions of power who are looking at our budget, I'll use New York City as an example. We spend $400 million a year in this city in our public school system under the guise of quote unquote school safety, and over half of that budget goes to police in schools. I can tell you, I will refrain with the bad language, but I can tell you that that's also not doing anything, right? So we need to work with those in charge to say, we need universal-based school violence prevention programs that focus on pro-social skill development. We need to implement restorative justice practices coupled with reductions in punitive disciplinary policies that just exclude kids, particularly kids of color, who are disproportionately expelled and suspended from their school systems. We need to stop hardening our schools, which actually perpetuate fear and increase the likelihood that kids are even bringing a firearm to school in the first place. So a lot of what we need to do is actually very counter to what people, I think, intuitively think about keeping schools safe. I'll also add that, of course, the mental health piece is so important, the connection between schools and existing community-based services. I love that you mentioned the grant piece. I'm going to just say this. Why are we making schools write grants? That is insane. We know what works. Schools don't have time to, I just came from this field trip. My kid's second grade teacher is amazing. She does not have time to be writing a proposal. What free time does this poor woman have? She doesn't, right? We're not paying her enough. Stop making us write grants. Maybe have someone like me write a grant. Okay, I can write a grant and then just give the money out. What I'm saying is there are so many barriers in place to do the most basic service access. So that kind of thing, removing those structural pieces, it sounds so obvious when I say it, but this is how we would move these solutions forward, because a lot of what we know we should be a lot of what we could be doing that works are things that we know work. Okay, I'll stop. That was my short response. Sorry. But anyway, all right. Yeah.
Akila, same question, kind of this, what are you seeing successful strategies? I would love to hear more about your work. And also, I know that you do kind of community healing and collective healing. So if you could talk more about that too.
Sure. There's a lot working. I want to just shout out the Biden administration. No sitting president in intervention work than this administration. The Safer Communities Act, $250 investment in community work. The White House launched an initiative called the White House Community Violence Collaborative. I had the for national TTA. We worked in 16 cities, 52 organizations. TTA, Trinity Technical, as a complementary strategy to policing. 18 months is not enough time, to create baseline. Look at the qualitative impact of our work. It was phenomenal. It gave birth to supporting several national initiatives that are happening across the country. So I want to just zero in on a couple of initiatives that are working right next door in Newark that I would love to invite you all over to see, right? So the Newark Community Street Team, launched in 2014 by Mayor Baraka and residents of Newark, launched NCST as a comprehensive strategy to address violence in the city. Three-pronged approach: high-risk intervention, training residents as credible messengers to leverage their relationship capital in neighborhood to prevent retaliatory violence, assertive outreach, which shows up as safe passage around schools. Started out at 4 schools, now at 22 schools. Basically, intervening, making sure that our kids go to school safely and that they come home safely. Huge impact, right, in terms of reducing violence and crime. When NCST launched this work in Newark in 2014, there was 103 homicides in the city. We did a study with the Safer Newark Council and discovered that 62% of the homicides started out as interpersonal conflicts and domestic disputes. And so this three-pronged strategy, high-risk intervention, assertive outreach, and victim services, was the strategy that we utilized to address, the violence in the community. And we had to do a proof of concept, so we targeted the South Ward, where most of this violence was happening. So we started at 4 schools in the South Ward. Now we're at 22 schools. We had such a huge impact on violence in the South Ward. I mean, I'm talking about 60, 70% reductions in homicide. We also did a study with the Department of Health and discovered that most of the conflicts was happening in and around schools, right? Things happen on campus, spill into community on Friday. Things happen in the community on the weekend, is on campus Monday morning. Southport Children's Alliance, who is one of the key partners in the CBI ecosystem in Newark, partnered up with several community-based organizations, applied for a federal Promised Neighborhood grant and was awarded. Just $30 million over 5 years. The impact was phenomenal in terms of academic scores going up, behavioral problems decreasing as a result of this coalition. So much so that the Department of Education actually gave them a second, had awarded us a second year a $30 million Promised Neighborhood grant. So just in terms of best practices. Our high-risk intervention work, started out with 16 independent contractors, making $15 an hour. Today, the Newark Community Street Team is the anchor nonprofit in the South Ward. We have over 120 staff. There's now a 20-person high-risk intervention team that is connected to the police dispatch. Every time there's a shooting hit or a shooting in the city, they respond to the scene. They never cross the yellow line. They're highly trained by the Professional Community Intervention Training Institute. The first 2 years of our work, 12% reductions in homicide in the city. During the pandemic, when violence was spiking all across the country, we had a 60-year low, during the pandemic. Our cops didn't shoot their revolvers, not once. We had a 12,000-person protest around George Floyd that was led by the mayor, in which we had not one arrest. Last year, we had another 60-year low. We had 50 homicides in the city, right? Now, one homicide is too many. And so I would say that NCST as a community-based, a community violence intervention agency is probably one of the best models in the country. And there's a lot. New York has, great infrastructure in terms of community violence intervention. Just want to lift up my brother Kay Bain with CCD, Community Capacity Development. They were one of the White House agencies that worked on civic with the White House. The president actually came to New York and went and visited some of the organizations, some of the community violence intervention organizations. Two other highly effective and promising strategies that are happening. California, some of the proudest, as I shared with you all, I'm a survivor. My oldest son was murdered 19 years ago. I co-launched an organization in California that is now the largest survivors network across the country, called Crime Survivors for Safety and Justice, with Californians for Safety and Justice and the Alliance for Safety and Justice. We're the #1 criminal justice reform in the country as well. We launched Senate Bill 580, which established the trauma recovery centers, right? Because one of the things that we recognize, and we talked a little bit about this earlier in terms of mental health services, Black and brown folks do not identify as victims, and they're not going into governmental buildings to get no mental health services in many cases, right? Because of the years of experimentation on Black folks, and they just don't trust it, right? But we established this Trauma Recovery Center, which is a national model, started in California with 12. There's now 38 all across the country. We brought it to New Jersey. We got our Attorney General and Governor to move VOCA dollars, Victims of Crime Act dollars, about $6 million to fund the TRC. And NCST applied for the grant. And so we run a trauma recovery center in the heart of the South Ward, first in the history of the city. We've seen over 600 residents in the neighborhood and provided comprehensive therapeutic services to them for free. They get 16 free sessions. If those don't, if they need more, they can sign up for another 16. They provide emergency relocation support, hardship assistance, and we have like probably a couple of hundred people on the waiting list now, right? HBIP, our hospital-based violence intervention program, University Hospital NCST program is one of the best in the state. I would say over 600 clients over the past 5 years that we've served. Is important relationship between hospital-based violence intervention and the community health workers who are embedded there that consent, the survivors' bedside, and their relationship between high-risk interventionists or credible messengers that are embedded in community-based organizations, right? There's a high threshold for arrest and prosecution. Sometimes Pookie gets shot and now he got to go right back in the same neighborhood where Raheem shot him at, right? And so it's important that you have these high-risk interventionists in the field that develop these safety plans and that can help navigate some of the relationships to prevent the retaliatory violence because law enforcement is not always able, to do it. And then the final piece is the public safety roundtable. Public safety is a very abstract idea to most people. You say public safety and people say police. We've advocated most of our responsibility to the cops, and so community has to be re-educated about what their role is in safety. And so we launched something, 5 years ago now called the Public Safety Roundtable, with 7 folks in the basement, at the old YMCA in the South Ward. And today we have over 150 people who attend the Public Safety Roundtable bi-weekly. And we've had major policy changes. One of the big ones, the two big ones. One, we reformed victim services in the state because there's a clause that was preventing 90% of Black folks from receiving victims' comp and victim services called contributing behavior. If Pookie was hustling and selling drugs out on the street and he got shot and killed, they would automatically disqualify his family from receiving services to bury him. And say if he or she survived, you got automatically disqualified from receiving any type of healing services or recovery services because they said that you were involved in your trauma, And so we reformed that in the state, with the Attorney General and the Governor's office. Folks who had warrants out for their arrest was automatically disqualified, from receiving services. We changed that. In addition, accessing victim services, comes through the police department and the prosecutor's office. And so one of the things that we discovered is that there was an administrative thing that was happening within our PD in which every time a detective put victim suspect on the police report and sends it to the prosecutor's office, they would automatically disqualify the person who was on the report. And so we had to work with our public safety director in chief and have an administrative change internally so that they stop putting victim suspect on the application to get people disqualified. Because one of the things that we discovered, and this was 10 years of data that was collected by the San Francisco Trauma Recovery Center, folks who get trauma support and healing and recovery support on the front end are more likely to cooperate with law enforcement on the back end. And so we were able to bring that data, to our PD, and we have a great working relationship with our PD. And our prosecutor in Newark. And it took some time. It took a lot of work, but I think that it's been a really hard-won victory. and it's really centered around leadership. So I think that there are a lot of promising initiatives that are happening out there under the CBI ecosystem that needs it still needs financial support and innovation because this is a field that is still growing.
Yeah, thank you. Kellen, can you tell us more about Neighbors in Action and some of the strategies that you're using? And then also, if you can just help us define violence interruption and violence intervention and how you see that play out in your work.
Absolutely. So Neighbors in Action, again, demonstration project under the Center for Justice Innovation was off the heels of the Crown Heights riots. And why that's so important was really that our program is really founded on two really main principles. One, a community's greatest resources is people. So how to use that resource to challenge issues, but also highlight an opportunity. Right? That happened a lot through mediation services, conflict resolution, and obviously evolved into many different things, right? Conflict is an inevitable part of all of our lives, but conflict doesn't necessarily have to be a negative thing. All depends on how you approach it, right? So that conflict could be transformed. Specifically with Neighbors in Action, how we approach these conflicts that community, again, whether it's poverty, investment in many spaces, franchisement, et cetera, we look for the opportunity. And in all of those spaces, we look at whatever that gap, that barrier that exists, right, and how can we eliminate it, or at least try to start building a bridge to get whatever it is that's needing on the side to that person, family, and neighborhood. The violence interruption aspect of our work, which we do through our Save Our Streets programs and is literally the same type of interruption that you would do eventually. Right? You'll locate where it happens. Usually happens, right? That time clock is usually 72 hours to be able to use, again, their people, their relationships, to figure out, gather as much information as possible. If the person is, if it's a non-fatal shooting, connecting to that individual, whether it's through our hospital responding program or directly in the community, to stabilize them. Do triage. Are you okay? What do you need? How can we wrap around you to let you know that even though this is a traumatic situation, we can highlight that within your neighborhood also has the supports that you. We also do that to eliminate retaliation, because if you can get a person focused, their energies towards healing and building, then there's less time to invest it in. The other aspects that we do within that 72 hours, which is so crucial, right? It's very important, and I'm going to piggyback a little bit off the last question with this a little bit here, but it's important to not normalize these things. So we do responses to shootings in our community in that time frame to not only denounce violence, but more importantly to, right, again, is the foundation for every individual to be able to see that, right? So we all benefit from peace, and everyone's responsible for safety. Individual, schools, businesses, organizations, everyone has a role to play. And our role might look different. Our role might just be like, you know what, let me say hi to this person here, there, and the third, just to let them know that I recognize their humanity. You never know when there's a moment that they might reach out for you for help, or if a scuffle or something's happening. Culturally, hey, cut that out over there. Y'all better than that. Sometimes something as simple as that could snap a person into mindset to remember that, yeah, I'm bigger than this. I have tools. Or also, I'm family, my friends, identity. Why neighborhoods create quote unquote crews is because there's a sense of very communal people. That concept always stays there. It's I wanted to talk about some models really quickly. Really approaches that I think that are really important and success. The first one is really well known, right? whenever we create any type of positive relationships, so that transforms how they themselves, but it also where we have social workers, case managers working with community members, not only address their needs, but also to help them speak. Goal setting is very cliche, but it's important, right? You even see sometimes suicide ideation, and in those spaces, if you get a person to invest in their future and to speak towards that, it sets a different pathway for them, something that they look forward to, and then there's a positive reinforcement. So that's what we do with programs and investments. The other part is physical placemaking strategies are so effective because the work we do with individuals and groups, if we're not impacting the environment that they have to navigate, it's a half measure, right? So how do we transform an environment to increase the protective factors? Placemaking and placekeeping does that. Specifically, when you involve community members in identifying quote-unquote hotspots, undesirable areas where all of the things that we don't want to see in our communities happen, they identify that, they come up with what they want to use that space for, and then the people themselves get to program, operate, and steward that space. That's franchising of people. That's also connecting them to spaces where they can leverage their own agency to elected officials, local organizations, X, Y, and Z. More importantly, a community is an organism, right? And anything foreign to your body has an immune system to expel it. If these initiatives, if these programs, if these projects aren't coming through the people, by the people, they reject it, right? So that's why placemaking, placekeeping is so important. And even when young people do this type of work, the way that they, just going off of what you mentioned about graduation, that sense of pride, again, identity. They'll tell their friends whether they like the thing or not, be like, so that's important. The last part, poverty. Jobs and jobs aren't enough, right? We know that any group, regardless of race, ethnicity, or whatever, you put them in those same conditions, you'll see those same outcomes. You can go through the history of New York with tons of gangs of a whole bunch of different races and ethnicities. But what happens, those things transform because the pathways for economic development were created. So I say all of that to say job programs are great, but we need jobs. Jobs are okay, but we need careers. We need entrepreneurship. And these things need to not be tied to someone getting involved with the justice system, right? Because all that does is net widen. And then all it becomes is another layer of control where people have more stress on top of them, where it's like, I know I should be doing this, but I have big brother over me telling me if I don't do this, I'm going to go there. And we know just from learning, right? People don't learn and retain information and practices the same way when they're in a stressful space versus when they're in a space of flow. So I think those things really help. And at Neighbors in Action, we use those frameworks to do not only responding to violence, but also to create spaces for people to become credible messengers themselves or to contribute to peace in many different ways. And I think one of the things I'm the most proudest of is when we get some of our participants who have been with us for years transform their lives and then become staff members leading programs. That's part of the sustainability that we talk about because our goal is to work our way out of a job. The longer that we're here, meaning the longer that these issues still are pervasive.
Yeah. Cohen, you said, I think a definition of peace that you just gave us is so beautiful. You said this earlier, it's not the absence of violence, but I think you said it was helping each person see a future, see opportunities. Yeah.
So I probably got that somewhere online now, so don't quote me for that.
That was beautiful.
I believe I said something about like peace is the foundation for a person to reach their potential.
Beautiful. Yeah, thank you. That is such a beautiful definition of peace. All right, so we're getting to the intersection of gun violence and incarceration. So I would love, Tatiana, you work in alternatives to incarceration. Where are you seeing success there? And really speaking so locally around New York City, to thinking about Rikers Island, how violent it is, the kind of net widening effect it has, not working as a violence prevention strategy. So where are you seeing kind of success in alternatives to incarceration?
Yeah, I mean, this is what I do every day. And so, you know, at the DA's office, we, the Pathways to Public Safety Division assistants, are embedded within the trial bureau. So when a case comes in and is written up with a detective or a police officer, the case is arraigned, myself, the bureau chief, and the assistant handling the case, we immediately start consulting about that case and how it should best be handled, right? We're coming from two different directions. There's prosecution and there's programming, and then prevention, which you're all talking about. But it's very important for us to differentiate, right? Every gun case is different, right? There are some people who carry guns for protection, some people who work late nights, who work as Uber drivers, who feel like they need it in case something happens. And there are some very small population in the city that is driving the majority of gun violence in the 5 boroughs. And those are the cases also that we have a lot of specialty bureaus that are very focused on criminal enterprises that are driving coordinated, premeditated shootings, murders, armed robberies, destroying the iron pipeline where we have straw purchasers, or people stealing guns from down south and bringing them up to Manhattan, you know, putting undercovers into these enterprises to make sure that we can get those guns off the street, and also a dedicated unit focusing on ghost guns, where children are making these guns at home with parts that they order online. And we, you know, unfortunately, sometimes have to prosecute those people. Unfortunately, sometimes because of sentencing guidelines, those people are incarcerated. We still want to focus on reentry when they come back to these communities and giving them opportunities, working with parole. But on my side, when that case comes in and it's a first arrest or someone early in their criminal history, we're going to look at what type of programming can we do for this person? Is bail necessary, right? Can we put this person back in the community with supports and get them started and connected now? And then enter into a plea agreement, which we have someone plea up front in felony court to a felony. They enter a plea agreement for 1 year. They're going to be coming back to court. They're going to be going to programming around gun violence prevention. They're going to be going to therapy, workforce development, pro-social activities. At Exodus, one of our partners, there's a knitting circle. And a bunch of these men sit down together and they knit. But what happens? If we have kids, a lot of us know when you want to talk to your child, you should do something else. You're building Legos, you're driving in the car. When people are sitting and knitting, they open up. And we're working to connect these people early. And if they can do this programming within a year, get connected with stable housing, and get connected with a job, at the end of the year, they graduate. And we are there every single time in court with them because it is a team. It's very rare on trial. It's a very oppositional, adversarial thing. But in these ATI parts, the defense attorney, myself, CJI that we partner with, those social workers, the judge, the court officers, the stenographers, everyone is there cheering this person on. And so my graduations like yesterday are so much more fulfilling in my career than any trial I ever got a conviction on. And so we, you know, getting back to your question about incarceration and Rikers, you know, that is a powder keg, and it is a toxic environment that makes it even harder for someone to survive. And so we are hoping to intervene early and to make this a crossroads where someone can, instead of this being baggage, a criminal conviction and justice involvement is something that made my life harder, give it as an opportunity, which isn't fair, as Kellen said, because we are the downstream problem, right? I get involved when every other agency and community issue failed them before, and now I have to fix it. But at least you get a holistic and curated and dedicated team that for as long as we have to, even if it's more than a year, we've worked with some people for 5 years, we're going to keep pushing because we really want you to succeed. I never want to see you in my courtroom again unless you come back as a peer mentor or credible messenger.
Wow. Drew, can you tell us too about some law enforcement strategies that you're seeing working in terms of preventing gun violence and addressing gun violence?
Sure. I want to pick up on what Tanya said about prosecutors' offices are changing. Our office is focused on 3 pillars set in the DOJ's Project Safe Neighborhoods guidelines, which are prevention and intervention, 1. 2, community engagement, and that goes to the importance of having the community on your side to help build cases. And 3, targeted enforcement. And everybody up here is experts on the first 2 pillars, so I'll talk about the targeted enforcement one. But one thing I want to leave you with is, as a prosecutor, I want all of this. I would love there to be more investment in the community and other ways to solve problems that aren't violence. I would be out of a job probably, but like that, it would be perfectly fine with me. I really want that. I do want to also leave you with, though, that unfortunately where we are now, I think there is still a role for enforcement. While we're doing all these other things to make our communities better, we still have to be protecting the public today from people who would do shootings and murders today. So one thing I'll mention is about a year ago, we started in New York City the Gun Violence Strategic Partnership. It's a daily meeting of about 25 law enforcement entities in the city. It's the Southern District of New York, the Eastern District of New York that covers Brooklyn and Queens and Staten Island, all 5 borough DA's offices, the NYPD, all the federal law enforcement agencies, FBI, HSI, ATF, parole and probation, both state and federally, state and federal corrections institutions, many other entities. They all come together and they talk about, in particular, recent arrests of people who are involved in multiple shootings. So if you're involved in 2 shootings, you're on a list of people that the police department and this entity is going to pay attention to if you're involved in another incident. That list is less than 1,000 people in a city of 8.5 million people. So it's 0.01% of people are involved in multiple shootings. That entity comes together and talks about who's going to best prosecute this case, what other information do we know about this person, what's on social media that may show what led to this shooting. And that has been an effective way to make sure we're building the best cases on those few trigger pullers that are causing the biggest problems for safety in the community.
So I think we have time for one more question. Maybe we'll just go down the line on this one. I think everything each of you has said has been a call to action. But if you can give us, I think, kind of 2 things, you can choose which one or do both. Kind of when we think about the kind of national conversation or the New York conversation on public safety and violence, I think you've already completely kind of added so much more nuance and complexity to that. It's not law enforcement versus everyone else. I think, there's so many kind of root causes and things that kind of make this demand a holistic solutions and holistic understandings of what's happening. So what are we missing in our conversation? What do you want to add to this conversation? And also as people of faith, as community leaders, what is the role? How can we support you? How can we support you in your work? And everyone is going to also be receiving more information and a call to action and resources of how we can support. But what should we be looking at? How can we support you?
We're all very lucky to be experts in what we do up here. But I was chatting with Sam Levy, and I worked together at the DA's office, and his mom and aunt, I think, were here. I don't know if they're still here. And they said something that was really amazing. Each of us, by doing one thing, collectively, we become a wave, right? And so it can feel really overwhelming to see the news every day. We don't hear the success stories. We hear, the failures. Each of you has the opportunity to do one thing to help one person, right? Whether that's mentoring, tutoring, being a welcoming person when someone gets out of prison and giving them a meal and just being an ear and being willing to listen to what they're going through. Donating money, doing a project, a postcard campaign, teaching your children to be inclusive and kind to others. These are small things that you don't have to be an expert to do. And if each one of you, I task you for this year to take one project that you can work with one person to help them, that's going to make an incredible difference in their life, and by extension, make a difference to their family, to their neighborhood, and to our communities.
So I think what I've loved about this whole discussion is I think a theme that every one of us have spoken to is that the solution to gun violence rests in a set of values of care and compassion. And I think that is so critically important to seeing people, whether they are perpetrators of gun violence or victims of or whatever, as entire individuals, as children all the way on through adults. And, I would say, I think what's generally missing from the broader public discourse is kind of 2 things. One is that this is a solvable problem. So my husband always laughs because he's like, he'll hear me talking and he's like, this is not rocket science. We know what we can do, right? We know what data drives good evidence. We actually have a lot of information as to what works. You're hearing, right, today, like so many existing solutions that work, and we need to ensure that they are scalable, that they are sustainable. And so we need to bring that to all the places in which we are having these conversations locally with our elected officials, at our school boards, at our PTA meetings, with our teachers, so that that messaging, it permeates, right, the constituents and the communities in which we all live and work and in which we're, you know, trying to do all of this. I think the other thing I'll just say is, and this is again clear from today's conversation, is that I think when you ask someone what is the solution to gun violence, people turn to law enforcement or a law. And I think those are parts of a solution and necessary components, but there's so many other components to gun violence and its solutions that need to be talked about. So the ways in which we can also collectively shape that public discourse in reimagining, like we really have to like flip that conversation on its head and kind of think out of the box in this creative way that says, yeah, green space is gun violence prevention, right? Stable housing is gun violence prevention. Investing in our schools is gun violence prevention. And that in our conversations, it's less about the gun as this political object and this point of division, and rather these broader, and I'm not saying that the gun is not, you can't have gun violence without a gun. So yeah, that is part of the problem, but that there are also these systemic factors that also need to happen. And drawing on, I think, Kellen's like beautiful vision of what peace should look like, what communities should look like. I think we want to bring that to our conversation. So that's really how I would think about it, and thank you guys for having us.
Yeah, I mean, I agree. The theme you're hearing, I think, is that we're all in this together. And I'm so encouraged to hear today people have so many different ways of tackling this gun violence problem. And we do have to come at it from 360 degrees. It's not just one way. I think I would encourage anybody here who's working on the many ways to solve the problem. I'm just putting in the pitch for keep law enforcement in mind. They're still part of that solution. They still want to help. There are things that we can do to help. We talked about grants at our office. Our office also issues those Project Safe Neighborhood grants to gun violence interruption programs to help support them in their work. I'll also tell you that NYPD is 35,000 officers. We all know there's been situations of bad police officers who have not been doing what they're supposed to be doing. On the vast majority, from my viewpoint, they're good people who are trying to do the right thing. Prosecutors and police are also just people who, for all of them, almost have decided to devote their career to protecting the public and their community. And I would just encourage you to share that message with other people as you go out there, that everybody's trying to do the right thing and find the right solution.
Can I just add one thing to that? You know, law enforcement and prosecutors were people too, and we don't take care of our mental health. We don't like to talk about what we see at work every day. I think we experience a lot of secondary trauma working with our victims, listening to the stories of our criminally justice involved individuals, officers who go to crime scenes and see what they have to see. So, you know, extend a little grace and listen to them. Ask them what it's like to work where they work and how you can be helpful to them, because building that bond in the community is so important.
I would just echo that and say that, you know, I count George Gascon and or Anderson, who runs the Alliance, either former or current prosecutors who do great work, internally, like with or aware that safety is a shared strategy. Law enforcement, single ubiquitous institution responsible for all safety is just impossible. And I think that that false narrative has to be something that has to shift. Because, he or she who controls the narrative controls the game. So the narrative around safety has been controlled by law enforcement. So I think that two things. One, I think that law enforcement plays a real strategic role in terms of what the future, in terms of reimagining like public safety looks like. that because I share, you know, our cops have one of the hardest jobs in the world, and they have to show up working in departments that are wrought with systemic racism and implicit biases, and they don't get any type of therapeutic and support, right? If a cop says that, hey, I'm having an emotional psychological break, you can get ready to be rubber gunned and dashed, you know. And it threatens, and if you're a black cop or brown cop, you got one foot out, you know. It threatens their ability to be able to sustain their families and themselves, and it makes it difficult for them to show up to work fully rooted in their humanity, right? So I think that, yeah, there's a lot that has to be done, but I think that only the public really help change, you know, that perception of law enforcement internally because of the cowboy nature of it and how, you know, deeply ingrained, like, kind of unions, you know, have gotten involved with this thing, protecting folks who might harm folks, right? You know, we all types of challenges on that end, like in terms of law enforcement, but at the same time, you don't see us trying to get rid of whole police departments. You know, that is not something that necessarily happens. And so here's the other thing that the second thing that I want folks to pay attention to. In this upcoming election, there's going to be a tremendous amount of conversation about community violence intervention and community, you know, based solutions. And I want to ask you all to give deference to community violence intervention practitioners, to Pookie, Raheem, and Sabrina and them. You know, folks that we traditionally don't think have the solution to the problem. But if we're thinking about violence as a disease and we're looking at this through the public health frame, those are the heroes and the sheroes and the saviors in our respective community. And we know that failure is a prerequisite for success. We have government that is losing, you know, billions of dollars all the time, and we bail them out. I mean, the Treasury Department lost not Treasury, but the Pentagon and Defense lost $1 trillion, and nobody knows where the money is, right? And it's like, but you let a gang interventionist, you know, get caught, you know, hustling, selling some weed on the side, or make some mistake, and it's on the front page of the news, and they're talking about getting rid of the whole agency because of a mistake of one or two folks, right? And so what I want to ask folks to do is that this is a new emerging field. And I tell you, in terms of making our community safe, it's our best chance at making our neighborhood safe, which is putting to work the individuals who used to be on the forefront of the violence, but who have atoned for their wrongs and who are now doing the hard work of making the neighborhood safe. Because it's dangerous. It ain't easy. Just like we pay cops high salaries, specialized training, the same thing that we have to do for these community violence intervention workers who are closest, you know, to the issue. And they're going to have intelligence about what's happening in the neighborhood, I mean, that law enforcement will never have. This is why we have to give them a chance and we have to invest in them. And we have to allow them to make several mistakes. We have to let them fail with millions of dollars, family. We got to let them fail with millions of dollars. And keep coming back to the table and keep investing in them. Just like we've done our current criminal legal system. And I'll close on this. Last year, you know, the collective is the first black lead TTA provider for DOJ for their community violence intervention, prevention, and free family. It's ridiculous. You know, it's something to be celebrated, but also it's ridiculous. You know, that this is 2023 and that this is the first time that an agency that is led by black folks who 30 years, you know, our practitioners have all been doing this work on the front line in the field forever, secured a contract with the federal government to provide, you know, TTA, right? And so when these bills come out, you know, and people, and especially in New York, because there's a lot of money, you know, through crisis management that is being invested in community violence intervention, and people be wanting to cut the money back. Tell them to double it, family. You know, and let folks fail a little bit, so that because the failure is going to inform how we move forward, you know, collectively. We've seen huge failures on one side, you know, and that failure has allowed our criminal legal system, you know, to do some things right, you know. And so we have to, you know, make the same type of investment and give the same type of deference and space to this new emerging, public safety strategy that's going to round out and bring some real balance to safety in our respective communities.
So I just want to echo those sentiments. I think the investment in these violence interruption, prevention programs and initiatives are so important, right? Again, I want to leave everyone with this. The goal isn't to reduce or to eliminate gun violence. That's not the goal. Gun violence is a symptom. A person has a cold, right? We don't just want to suppress the cough. We want to get rid of the virus, we want to get rid of the disease, but then find out what were the conditions that led to that. Because if we don't get back to the conditions, we're just keeping it in place. These problems in motion, perpetuity. And we know where these problems exist. It's segregated on purpose, right? But again, if you look at gun violence, right, as a public health, through a public health lens, we know diseases, just like bullets, don't have names. Those impacts affect all of us, right? So when you're thinking about what your contribution could be, think of it like this. What's your contribution to a person who's not feeling well? How can you make them feel better? Maybe that's a conversation. Maybe it's just acknowledging that I see you're in pain. Maybe it's donating, whether it's time, resources, or whatever it is. But just know that each and every one of us are equally responsible for the conditions that we have today, and we're responsible for that next generation, right, what they come into. Lastly, remember your power, right? Sometimes it's easy for us to feel powerless, right? Every shooting's happening all the time. I don't know if what I have to give might be received. Give it anyway, right? Because after a while, what we need to do is retrain ourselves and retrain others to see what's the most valuable thing. And it's humanity. It's life. And what we share between each other have the power to construct a new reality or to keep lesbian community.
Wow. Wow. Thank you all so much. That was such a beautiful conversation. I'm so grateful on behalf of JCRC. Thank you all so much for being here, and I'm so grateful for your sharing personally and professionally. And I'm really taking away with me this idea of in the face of violence, to feel empowered, to recognize the work that you're doing and the multiple strategies to creating conditions of public safety and mostly for peace. So thank you so much. Grateful for your voices, and thank you all so much for being here.
As we were sitting here listening to solutions, there was a mass shooting in Atlanta. 4 people were wounded and 1 person is dead. Unfortunately, the journey goes on. I want to thank the panel as well. Are you going to ask questions now, or are you going to do questions? But I just wanted to let everyone know that as we talk about solutions, the problem rolls on.
Good. Yes. Thank you. Yeah.
All right. Thank you again so much to our panelists. We're going to move on to our breakout sessions, if that's okay. Thank you again.
Thank you.
Okay, so before we all move, I'm just going to make a quick, except for our panelists, of course, I'm going to make a quick announcement about where our breakout sessions will be. After listening to all these incredible speakers, I'm sure we all want to join the conversation. So let's get talking about this issue. So we have 5 breakout sessions. Sorry, 6 breakout sessions. The first one is what is the role of faith communities, with Rabbi Menachem Creditor and Reverend Dr. Kelly Rogers, and that will be in this room. There's 2 sessions in this room, so we're just going to have one on each side if that's okay. Hopefully you'll be able to all hear each other. All right, they will be on that side. And then the other one in this room is called, which one of our panelists mentioned this exact phrase, the trigger is pulled before the trigger is pulled. This is a conversation with Derek Scott from Operation Hood, which is a project within the JCC of Greater Coney Island. They'll be on this side of the room. And then We have a circle process, a community listening and reflecting circle with Amy Ellen Bogan, who you heard got a shout out earlier. That will be in room 717, which is right across the hall right over here. A deeper dive into gun violence in children with Andrew Pearson and Rebecca Wolf from the Jewish Board of Family and Children's Services will be in room 706, which is right down here. And right next door to that, we will have a Stop the Bleed training with 3 doctors from Weill Cornell who are sitting right here, and that will be in room 708. And last but not least, we're going to have a session on the next steps, building a movement, and that will be in room 654, which is downstairs. Please don't leave after these breakout sessions. If you can, please come back. We're going to hear from 2 last speakers, and then we will conclude our day. So let's go.